Madam Secretary, are you on?
Can you hear me?
Yes, we can hear you now.
Wonderful. Good morning. Good morning. Thank you all for allowing me to join you by phone this morning. My schedule just did not allow me to be in Topeka. Please, if at any point in time I go out or if you can't hear me, let me know, and I'll try to check in. Excuse me. I wanted to give some quick updates and then leave time for questions, as I know some of you may have questions around the Spark activities and just where we are overall with recovery. Couple things, starting with our Spark advisory panels. The Spark Executive Committee did meet on October 25th, Monday, October 25th, to discuss the 4 advisory panels, and were at that time nominations were given for chair and vice chair and were approved. We did send that along to the committee in print form, so you all should have it, but I'll just rattle them off real quickly. Economic Revitalization is Representative Sean Tarwater, Vice Chair Tien Kuhn. Health and Education, Senator Renee Erickson, Vice Chair Robin Chadwick. Connectivity, Senator Mike Peterson, Vice Chair Stanley Adams, and Efficiency and Modernization, Representative Troy Waymaster, Vice Chair Mark Hutton. The next steps around the advisory committee is actually, as the executive committee is working to hire the Spark project coordinator, which was agreed upon by the executive committee to help move this process forward. That executive or that project coordinator will help in administering the advisory panel process. And so that is in motion, moving quickly, and it is on our agenda for our next meeting around the Spark coordinator, which will then help us to kick off the advisory panels. We do still hope that the panels will begin to meet before the end of the year and start their work knowing that it will be ongoing through the spring. Additionally, since the last time we talked, Spark Executive Committee has held 2 regional meetings to gather feedback from the public and stakeholders on how to utilize the state recovery dollars. One was held in Wichita on the 18th, and the second was actually held in Dodge City yesterday. At both, we had close to 20 in-person testimonies. I think there was around 21 in Wichita, about 18 in Dodge City yesterday. We also have received written testimony for both of those. They were received through those dates. Dodge City is still open for written testimony, so we may receive additional pieces. Overall, I would say across those our regional meetings, the main things we've heard about is, I think like all of us know, priority areas: manufacturing, child care access and affordability, small business support, mental and behavioral health services, a lot around workforce support, retention, and workforce development, both in the healthcare sector and various other sectors, housing, low and middle income, moderate housing options in various ways. And we've heard from different entities or organizations in both locations. Some of them, actual counties or cities, have come out. When we were in Dodge City, the 3 community colleges in that region, Seward, Garden City, and Dodge City community colleges, all were present. We've also heard from various development groups or corporations, as well as nonprofit and other community-based entities, like Habitat for Humanity or YMCA. So it's been a really, I would say, broad swath of stakeholders that have come out, either public in the open forums or that have submitted that testimony. We do have one more regional meeting scheduled, and that is for Kansas City on November 15th at 8 a.m. It'll be held at the Kansas City KCK Community College at their Technical Education Center. And so we anticipate another round of great stakeholders. A couple of other updates. As the last time we talked, we did share that the healthcare frontline workers hospital initiative had kicked off. This was the plan that the Spark Executive Committee approved back in early September. And this is to get dollars to the hospitals around supporting the retention of frontline workers. That application closed last Friday, October 29th. And of the 122 eligible facilities, 118 actually applied and will be awarded funded. There were 4 that did not. We have contacted them and made clear they have an understanding, and we have reached out to their legislators to make sure that they were aware prior to and that they did not request funding. I will say that over half of the applicants came in within that last 24, 48 hours. So we're still processing them, but starting to move money out the door. It'll go out on a rolling basis, but we should have everything pushed out to all of those that have applied within the next 10 to 12 days. We just have to make sure we're doing all the paperwork. We did hold a webinar for all of the participating hospitals this past Tuesday, had well over 100 attendees at that webinar. And we really focused in that webinar on answering any of their questions, but even more particularly around the reporting. The reporting requirements both set out by Spark, but also those that are set out for federal compliance for the utilization of those dollars. And so their first report of their data is due, both their baseline and any additional reporting requirements is due November 15th, and then they will report monthly thereafter until March 15th. Those are my quick updates. I can entertain any questions you all may have. I think that's all I had prepared. Thank you, Mr. Chair.
All right, thank you, Madam Secretary. And I guess the last time that you had give us a briefing to this committee, we were talking about the Spark process. And at that time, there was the intent of having some of the money that's going to be received through the ARPA funds distributed by the end of the year. And I know on the telephone conversation that you and I had a couple of days ago that has changed. Can you kind of explain that?
Well, what I would say is I think that there's still an intent to be able to get some of the dollars out the door by the end of the year. The process is, I would say, like maybe shifted a little bit because of the need to get the coordinator in place and then kick off those advisory groups. And so that's why I do believe that there is still an interest in bringing those groups together by the end of the year, being able to start some of those conversations, maybe even be able to identify some things that may be low-hanging fruit or kind of, emergent, immediate needs to push out some of those dollars. But the process always was one in which we knew there would be a couple of rounds and some dollars out by the end of the year, more dollars out in the spring, and then, final allocations, through next summer. So it may be a shifting of that just a little bit, but I do believe from everything I've heard just from the committee members, there's still an interest in trying to get some dollars out the door because we know that there are some immediate needs that have already been identified. What I will say, and as we kind of are moving through this, we're kind of, those, when you hear that, those sayings like, building the plane as we're flying it, there's a piece of this that, it is still evolving as we pull this through with our timing, as pulling the committees together, as we're hearing the stakeholders. So I would say in another probably week or so, and definitely by the meeting on the 15th, I think we'll be able to give a much clearer picture to the chairs and the advisory groups of the timeline and then what that looks like. So it's not a clean answer, but part of it is that I don't know all of it, and I don't want to, speak for the entire executive committee as we're still working through some of these, the logistics of it.
All right, thank you. Senator Billinger.
Thank you, Mr. Chairman. Thank you for being here today, Secretary. You mentioned on the hospital funding that is just ended. Will them funds go out before the end of the year?
Yes, those funds have. So the hospitals that applied, those funds are actually going out the door already. We have pushed out probably a little over $5 million so far, and the rest should be out within the next 10 to 12 days. Those are ready to go. It's more of like we needed them to get their application processes in. Then we have to put, agreements in place for the transfer of the funds, and then those are going out the door. So the good part about that is that the hospitals that applied, they know their allocated amount, so they can start doing, and because some of it will be reimbursement for, the expansion of those salaries for retention, so they can start planning and utilizing and know the dollar amount that's coming to them. But we will be making those formal transfers where they will physically have those dollars. We should be done transferring back out with as long as everyone's paperwork is in by the middle of the month. So there's no delay in those dollars, sir.
So does each hospital produce their own guidelines? They decide who to pay, how to pay, and does everyone working at the hospital get paid?
No, sir. So there were guidelines that were set on the program, and we can make sure those get back to you. That was set by the Spark Executive Committee as to what it looked like in eligibility. And then there was an option that was put in by the Executive Committee that if a particular hospital wanted to use it slightly differently, that there were parameters around that, and they actually had to submit that as part of their application. And then that's why the reporting pieces are so important and why we kicked them off with a webinar this week, because there are certain things that both Spark and the federal government are asking for to make sure that those dollars are being used in the way that were set out, and that's why they have to report monthly so that we're monitoring that in that way. So, but we'll make sure that we push back to your committee the outline of the design of the program, as well as how the hospitals, what's allowable for the hospital to use it for, the type of workers, and et cetera.
So do all the people working at the hospital get the bonuses?
No, so this was designed to be for the frontline workers, and so there are various categories within that, including like the nursing staff, respiratory support, things of that nature, and that was the design of the initial program.
So some people working at the hospital will not get bonuses, is what you're telling me. How about traveling nurses?
Mm. So, sir, the design of the program is that it goes to the hospitals for them specifically to support the retention of their frontline workers in that space. And so we can provide more details on, again, what are those categories. And again, if any particular hospital is doing something that is slightly different, what they propose for that as a part of their program.
My concern is that you've set parameters, you said. The Spark Committee set parameters, and that there's going to be people that are working at a hospital that you may determine that they are qualified or they may not be qualified. But it seems to me like anyone working at a hospital is probably pretty important and pretty essential in this pandemic. And it concerns me that we're going to pick winners and losers at these hospitals, and particularly in nurses where there's a real shortage. So I'd like to have those guidelines, because that concerns me a lot. Another thing that I'd like to know, all these federal dollars, are we going to be able to use these federal dollars for testing?
So federal dollars, in terms of the relief dollars, have been used for testing throughout. One of the things that was on our agenda at Spark yesterday was actually to look at some additional testing dollars to support extending some of our testing contracts a little bit further out. And the Spark Committee is actually taking that up at their next meeting. We're pulling some data. We can share that data with this group as well around the testing, the dollars that have been spent of the various relief funds, and what that looks like.
Well, we're talking about, private businesses now, and we're talking about retention of their workforce. And I understand that part of the OSHA mandate yesterday said that if you have the option for testing versus getting the vaccine or getting the shot, that businesses would start to have to pay for their own testing. And I think it's, I think if we've got federal dollars, I think testing should be provided for all businesses. And I don't know if Sparks talked about that or not, but do you know if that's been considered?
As I said, sir, it's on our agenda for our next meeting. Testing is a very complex, layered issue. So one of the things that the Spark Executive Committee asked was that as KDHE is the agency that has been organizing, managing all of the testing and those funds, that they will be at the next Spark committee to answer some of those questions and to talk about what this looks like and what that landscape of testing and funding looks like. So as I said, we can share the information that is being prepared for the Spark committee with this committee as well.
Well, I think it's important that we do it, and we do it in a hurry, because I had many phone calls yesterday from businesses that are very concerned about not being able to have testing.
Well, and Madam Secretary, if you could also elaborate, when is the next, when did you say that the next Spark Executive Committee is?
The next scheduled one is November 15th, so it's in like not quite 2 weeks, and just under 2 weeks.
So we're having an issue with the testing lab at Wichita State University where on November 30th, they will no longer, I guess, be receiving funds to do any testing. So would we be able to have that as a discussion at the Spark Executive Committee meeting on the 15th and then have that approved by the State Finance Council to continue Wichita State doing testing?
So again, it's part of that larger conversation, understanding that, remember that Wichita State is one of many testing contracts that were stood up. And so that's why it's this larger conversation. And yes, that is a part of the conversation that we plan to prepare for the November 15th time period.
All right, thank you. Senator Hawk.
Thank you, Mr. Chairman. My question is should probably go to the Spark Executive Committee, but maybe Secretary Burns-Wallace, you can answer this. I have two concerns. One is the accountability piece for the expenditure of the funds and how that reporting goes to the feds. Is the coordinator who's not been hired going to be responsible for that on these discretionary dollars, or is that going to be done through the recovery office that we currently have? Has Spark dealt with that, the executive committee, with that accountability?
So all of the state's recovery relief dollars, all of that compliance and reporting from day one has come through the recovery office, and that will continue. This coordinator is being brought on to help manage the Spark process, the flow of information, moving, and the strategic conversations. And it was a conversation at that Spark Executive Committee of wanting someone that was brought on across that group to help move that process. When it comes to the compliance and the management of the overall dollars in terms of federal compliance, all of our reporting, all of that has set with the recovery office and will continue to do so. It is also tied to in the Department of Administration, our Office of Accounts and Reports, which is the office that is responsible for all of the state's federal reporting. It's also the office that's responsible for all of the state's single and comprehensive audits. So we tied those together to ensure that that was embedded in our regular processes, that all of the internal controls that we use for any other federal dollars ran across these dollars. Additionally, that reporting has happened from the very beginning. We have both federal quarterly reporting. We have some in-state reporting that we do up as a roll-up from the agencies that's monthly. All of that, it has been, and we continue to transmit those on a regular basis, but we also share those with KLRD so that they know all of the reporting that's happening. So that reporting, some of that, when we were going through session last year, I was in some of the budget committees and sharing some of that reporting. It is ongoing. You guys can get access to that at any time. And you can see what we report federally, quarterly, because the OIG reports are quarterly. And then we also, as I said, for various buckets, also do monthly internal so that we're rolling all of that compliance and that reporting up.
Secretary Burns-Wallace, thank you very much. And that certainly makes me feel better in my role on Ways and Means, knowing that we have that accountability. Final question, is there a job description for this coordinator, or is it just a generalized expectation for that position to facilitate the Spark Executive Committee?
There is a job description, and I know that the Lieutenant Governor who's chairing Spark, along with leadership, have looked through that, and they are the ones that are helping to manage that process of that selection of the coordinator, and then they'll be bringing that back to the larger Spark Executive Committee for our final consideration.
And do we have a expected date when that coordinator position will be hired and on the job?
The goal is as quickly as we possibly can. They are moving quickly and aggressively.
Okay, thank you. Thank you, Mr. Chairman.
Ms. Sutton.
Thank you, Mr. Chair, and good morning, Dr. Secretary. How are you this morning?
I'm good.
Excellent. My question goes to the 4 hospitals, I think you said, that did not apply for federal funds. That seems out of character to me. So was that just a matter of inactivity or inaction, or was that a conscious decision, a judicious decision?
Yes. So 3 of the 4 are part of a system, and that system spans multiple state borders. And it was a conscious decision, and which we talked with them, and I believe they, did their own internal conversations around declining to apply for those dollars. So 3 of the 4 fell under a larger system, and I think it was the system's decision. And then there was one that is a smaller rural hospital, and we reached out to them multiple ways, reached out to legislators, reached out to local officials in that district, and we never received any reply or any response from them, and they did not submit. So does that help answer?
It did, and I appreciate the answer, and 3 of the 4 make sense to me. Are there certain requirements that are in place that might make accepting this federal money more problem than it's worth? Could that be part of the decision for that last holdout there?
It could. Again, we held various webinars and tried to push out frequently asked questions so that they understood what their reporting requirements would be. Because it is, again, both those that were set in place by Spark as well as some federal reporting requirements to receive these dollars. But we tried to be clear about what that looked like. We provide templates to try to, make it easier for them to be able to comply and do what they need to. What I would say is that I don't want to second guess the hospital or anything of that nature, but we tried to make sure that we had contacted other leaders within that community for their awareness prior to the closing date, because we had not heard from them. With the decision of them not applying, we did not, push any further, but we did contact them throughout the process.
Excellent. All right. Thank you. Thank you very much. And thank you, Mr. Chair.
Representative Wolfmore.
Thank you, Mr. Chair. To follow up on Representative Sutton's question, I happened to sit with one of those systems at our KHA dinner the other night, and they said indeed that they weren't sure what kind of problems would occur if they were giving their employees, on the Kansas side, and in the metro area on the Missouri side, they couldn't do it. So they did say that was a conscious decision in their case. And then to follow up on the types of employees that get the bonuses at the hospital, you said frontline, so I assume that means clinical, patient-facing, taking direct care employees, correct?
Correct. I don't want to misstate. It was stated in the documents, and so I apologize because I don't have them in front of me. I will make sure that our team gets that to you all, because there was an outline of the type, but how you described it is, I would say, the essence of what the intent was.
Yeah, as for example, I work at a hospital. I work in community relations. I rarely go into the hospital now. My job's gotten easier. I certainly wouldn't, people that work in my kind of job certainly wouldn't deserve or need a bonus. I think it needs to go to the people that are patient-facing and are doing that tough work and where we're finding our shortages these days. Thank you very much.
All right, committee, I'm not seeing any further questions, and Secretary, I know you do need to leave pretty quick, but I think Amy has a comment.
Thank you, Mr. Chairman. I just wanted to indicate in your packet, you should have a copy of the report that the Secretary mentioned. It's the data regarding COVID expenditures through September, the end of September 2021. Apologize for the smaller font. It's the best I could do and get it all on, all the columns on one sheet on those backs. But if you have any questions, please let us know. That is available for your review.
And that includes all the relief packages, including the American Rescue Plan Act. And is this I have the title right, discretionary funds or non-discretionary?
So this would include both the discretionary funds as well as those direct that have more specific requirements. So we've tried to indicate on there the columns which those are, both which federal legislation it came through as well as the federal program. We'd be happy to go into more detail if you would like us to. And
this does not include the $1.6 billion that's coming to the state from the American Rescue Plan Act that the Spark Committee is going to be.
No, sir. It should include there. You might not see any activity. Right. You might not see any activity with the 1.6 through September, just depending because of things when dollars started to move. Does that make sense? So it technically is part of that same reporting package, but I don't know. The one thing that's moved with ARPA was the $250 for the UI Trust Fund. I don't know the timing of when that hit the books. If it hit before the end of September, you would see that. And then you probably wouldn't see anything else on that report related to ARPA because it hadn't started moving yet. But it would show up when you guys get the next report, like the dollars that are going out to the hospitals, those should start to show up. Does that make sense?
Yes, that makes sense. Thank you for elaborating on that. All right, any questions for Amy in regards to the spreadsheet or the handout? Okay. Thank you again, Madam Secretary, for being here, and thank you, Amy, for the description in regarding the handout in our packets. We'll now turn it over to an update on the Human Services caseloads, and so I'll now turn it over to Megan Leopold, the Fiscal Analyst for the Kansas Legislative Research Department. Welcome to committee.
Thank you, Mr. Chairman. I'm Megan Leopold, Legislative Research. I'll be presenting on this purple colored memo that you have. The Human Services Consensus Caseload team met on October 28th. And at that point, we revised the estimates for fiscal year 22, and we also developed new estimates for fiscal year 23. The estimates included expenditures for TANF, cash assistance, the reintegration foster care contracts, CAN care regular medical assistance, as well as KDHE-led's non-CAN care. I'll start with fiscal year 22. For fiscal year 22, the starting point that we used was the budget that was passed by the legislature in 2021. That was House Bill 2007 and Senate Bill 159, which was the omnibus bill. This also included the estimates that we made in the spring. It also included adjustments for reappropriations that were made for money that was not expended in 21. For fiscal year 22, the revised estimate for all human services caseloads is $4.0 billion, and that's including $1.1 billion SGF. This is an all funds decrease of $72.5 million, and that includes a decrease of $173.2 million SGF. And again, that's below the budget that was approved by the 2021 legislature. For TANF cash assistance, the estimate is 9.0 million all federal funds. That's a decrease of 1.9 million. And we've seen that the caseload has had a steady decline since June of 2020. And it appears that that could be due to the stimulus checks that were provided as part of the public health emergency. For foster care, the estimated expenditures are 259 million, and that includes 174 state general funds. This estimate is a decrease of 16.5 million, including 17.0 million from the SGF. This is a decrease that's largely due to 10 million in reappropriated funds from fiscal year 21. Also of note, DCF received 4.1 million from the St. Francis settlement. 2.0 million will be expended for foster care in fiscal year 22 and 2.1 in 23. For CanCare Medical for fiscal year 22, and as a reminder, CanCare Medical includes medical expenditures for KDHE as well as primarily expenditures for mental health and long-term care expenditures for KDADs. For fiscal year 22, the estimate for CanCare Medical is 3.7 billion all funds. That includes 948 state general funds. This is a decrease of 51 million all funds and a decrease of 152 million SGF. The reasons for the all funds decrease were largely an MCO rate adjustment. This was lower than what was anticipated in the spring estimates. There's a decreased fee for service payments, and this is due to, we've just seen a decreased utilization of fee for service since the start of the public health emergency. There's also a decrease of 6.9 million, and that was from the Nursing Facility Provider Assessment Fund. The revenues for this fund have been down since nursing home census has been down. This all funds decrease was offset by some population growth. The population growth was higher than what we anticipated in the spring. That's because the public health emergency was extended for 2 more quarters of fiscal year 22 in the fall estimates than it had been in the spring. And because of the regulations that require that no members are removed from Medicaid during the public health emergency, we've anticipated that that growth will continue to rise through 3 quarters of fiscal year 22. The SGF decrease is primarily due to that same reason, that 6.2 FMAP enhancement that comes with the public health emergency. That moved the FMAP from its base of 60.04% to 64.69%. Like I said, the public health emergency is expected to continue through January of 22 at this point, which means that it'll be in the FMAP will be in effect through the end of that quarter, which takes it through March of fiscal year 22. The savings from that extended FMAP for the 3 quarters of 22 is expected to be about 170 million. For KDAD's non-can care in fiscal year 22, the SGF estimate is, the estimate is 39.4 million, and that includes 24.6 million SGF. This is a decrease of 3.6 million and includes 4.4 million SGF, and that is below the approved amount. This decrease is due to lower nursing facility fee-for-service payments. Moving on to fiscal year 23. The fiscal year 23 revised estimate for all human services caseloads is 4.1 billion from all funding sources, and that includes 1.3 billion from the state general fund. This is an all funds increase of 92.9 million, and that includes an increase of 170 million SGF above the fiscal year 22 revised estimates. So the fiscal year 23 estimates are being compared to what we estimated for fiscal year 22. For TANF, the estimate is 8.6 million, and that's all federal funds. This is a decrease of 400,000 below the fiscal year 22 revised estimates. For foster care, the estimates are 266 million. That includes 185 million SGF. This is an increase of $7 million, and that includes $11 million SGF above the 22 revised estimate. The increase includes replacing $3 million from the fee fund that was a one-time reduction as part of the governor's reduced resources budget in fiscal year 22. For KanCare Medical in 23, the estimate is $3.7 billion from all funding sources, and that includes $1.1 billion SGF. This is an all funds increase of $40.6 million and includes an SGF increase of $139.4 million. The all funds increase is largely due to $41.9 million in risk corridor payments. These were anticipated to be recouped in 22, and that's due to lower utilization of services in fiscal year 2020. There's also a 3% increase in nursing facility provider rates, and this added an additional $21.5 million, and that includes about 8.6 SGF for fiscal year 23. The estimate also includes $14.1 million, and that includes $5.7 million SGF for Medicaid funding for services received at Certified Community Behavioral Health Clinics, or CCBHCs. KDADS does expect they're doing a phased-in process, and they expect to have 9 CCBHCs certified for fiscal year 23. The all funds decrease for KanCare Medical is offset by decreased capitation expenditures. These resulting from the end of the public health emergency or the anticipated end of the public health emergency. Guidance from CMS allows KDHE to have 12 months to remove anyone who is no longer eligible at the end of the public health emergency from Medicaid. So we anticipated that there will be a pretty steady decline from March of fiscal year 22 to March of fiscal year 23. The all funds increase is offset by a discontinuation of the health insurance provider fee. This included a payment of $94.9 million in fiscal year 22, and no payments were included in fiscal year 23. The SGF increase is largely attributable to that, the 6.2% FMAP increase not being included in any quarters of fiscal year 23. For KDAD's non-KanCare, the estimate is $85.1 million. That includes $44.2 SGF. This is an increase of $45.7 million. That includes $19.6 SGF for fiscal year 23. And that, again, that's above the fiscal year 22 revised estimate. This is primarily due to the inclusion of PACE in the consensus caseloads estimating process. Recently, up until fiscal year 23, only the medical portion of PACE had been included, but beginning in 23, all PACE expenditures will be included in the human services caseloads. I'm happy to stand for any questions.
This might actually be for the next presenter, but maybe you can answer it too. So, I mean, right now we're in fiscal year 2022, and you said we have the public health emergency until January 1 of 2022?
It's early January, I believe, is when it ends, but all of the stipulations that come with that, including the FMAP, continue through that quarter. So they'll be in effect through March.
Oh, through March, all right. So, and I think you kind of answered that a little bit when you were talking about KanCare Medical in fiscal year 2023. So the anticipation is that the public health emergency is going to be lifted by the federal government, and then we're going to see an increase because we're not going to have that adjusted FMAP rate of about 6.2%. Is that correct?
Correct.
It's going to go back to the 60%, and then we're going to see an increase in KanCare Medical when we're doing the budget for 2023.
Right. We'll see an increase in the state share. So,
State share.
Yeah.
Which has been a concern when the federal government adjusted the FMAP rate. Representative Sutton? Oh, he doesn't have a question. Representative Johnson.
Thank you, Mr. Chair, and thanks for the overview. I was just trying to get a handle kind of at a high level, and the chart at the end was helpful to get an idea of what was happening with the all funds budget. As I read or heard you in the detail, and you may have explained it and I missed it, the swing in the change from 22 to 23 in the SGF portion is a little more dramatic than the all funds. The two things that I was interested in, if you could review again for me what swung SGF so hard, and then if I'm looking at a 170 million decrease in 22 and 170 million increase in 23 above the estimate, I was trying to get an idea, is that total swing then year to year in the 340 million range as I went, just trying to get a handle on where we are if both are comparing to the estimate. And then is the 23 baseline really the one that I'm looking at going forward, and the 22 being more of a aberration. So what's the difference from all funds to SGF, and then where might we be going forward?
Okay. So to answer your last question, yes, I would say that fiscal year 22 is more of an anomaly because of that 6.2% increase in the FMAP. So fiscal year 23 would kind of be getting back to normal of sorts. So with the public health emergency for the first, which is anticipated to go through March, so the state share of the Medicaid program is going down because the federal government is paying an extra 6.2%. So for that year, so for fiscal year 21 or 22, the all funds is going to stay pretty stable. It'll go up a little bit because we are anticipating some increase in population with that, with the public health emergency. But because of the shift in how much the federal government is paying, the SGF is going down for fiscal year 22. So the all funds will stay relatively stable, but the SGF will go down because the federal government's actually paying more of that share. And then when you go into 23, you're going to see the all funds stay relatively the same, up a little bit, largely due to population increase. But you're also going to see that SGF go up quite a bit, and that's because that state share has gone up by that 6.2%.
President Johnson.
So thank you for that. And then you said the all funds was not a large increase in 23. Did I hear that correctly? Looking at the 93 million on the 4 billion, so not a huge amount as we look at the overall spend. And is that a pretty normal variance that we see in a year-to-year change?
As far as the variance, I can't answer that for sure. But I would say that, you know, going from 4.0 to 4.1 billion is probably not out of the norm.
Okay. Thank you. And thank you, Mr. Chair.
Senator Billinger.
Thank you, Mr. Chairman. Thank you for being here today. And Representative Johnson got part of mine, but when do they adjust the FMAP?
So it's adjusted once a year by the federal government.
Right. But when is that done? I mean, because we're already assuming in 23 that, has that FMAP already been adjusted, or do you already know the numbers?
We have a pretty good idea. They give us estimates, and they tend to be pretty stick to what they estimated. They're based on the federal fiscal year, so the FMAP is changed at the beginning of each federal fiscal year. Right,
because like the last 3 years has been very favorable to the SGF, and you're saying now that the 6.2 is going away, that we're going to have to worry about that, which we will. But that's why I wondered if you've already seen those numbers, so thank you.
I guess I kind of have a question about that from Representative Johnson and then Senator Billinger, and then also kind of the question that I was asking before. And I know this is purely hypothetical, but is there, because if we look at 22 and 23 in regards to the adjustments in all funds, well, not really all funds, but in the state general fund portion at least, when we're trying to put the budget together for fiscal year 2023 and that public health emergency is lifted and the FMAP is adjusted back to 60%, I mean, that 169 million SGF, even though it's kind of balancing things out prior to the adjustment on the FMAP, it's still going to look like an increase in fiscal year 2023. So I guess my question is there any anticipation or has there been any conversation that Congress may maintain the 6.2 adjustment in the FMAP?
Not that I know of. Everything that I've heard up until this point is what they've been saying from the beginning, that it'll be in effect through the end of the quarter in which the public health emergency ends.
All right. Like I said, it was a hypothetical question. I just wanted to ask that. Any other questions for Megan? All right. See none. Thank you. We'll continue the discussion with Medicaid topics now. And so I would now ask that Ms. Sarah Fertig, the Medicaid Director, to discuss the budget neutrality, which is kind of elaborating on the conversation that we were just having with Megan. Sarah?
Thank you, Mr. Chairman. Good morning, committee. If I may, I have some slides that I can pull up if I can share my screen. So bear with me for one moment as I do that. Here we go. All right, I see it come up on your screens. So good morning, everybody. My name is Sarah Fertig. I am the State Medicaid Director. I work within the Division of Healthcare Finance at KDHE. And I have a couple slides here to talk to you about a very important, but admittedly very dry topic of our current CanCare 1115 waiver budget neutrality. I will go ahead and get going. So just a little bit of background on Medicaid for those of you on the committee who aren't super well versed in how Medicaid works. Medicaid is a state and federal partnership. And more specifically, the federal government is kind of the senior partner on Medicaid and the state is kind of the junior partner on Medicaid. And the way it works is the federal government, specifically the Centers for Medicare and Medicaid Services, or CMS, they approve the state plan, which basically describes how Kansas intends to administer its Medicaid program. And in exchange for that, the feds typically pay about 59 to 60% of our Medicaid medical costs in any given year, as Megan Leopold just went over. And as you know, under the pandemic era rules, the current federal match rate is closer to 65% for those costs. There are some other costs that the federal government contributes to, for instance, salaries for the Medicaid agency. My salary, for example, is paid 50-50 state and medical fund or Medicaid funds. There are other projects that we work on, IT projects, where there's an increased match rate where it's closer to 90% federal dollars. But typically for the actual medical costs, it's usually around 60% paid by federal government, and currently it's closer to 65 under pandemic rules. And states have a lot of flexibility in how we choose to structure our Medicaid programs, and you won't find any two states that have their Medicaid programs set up identically. But the key component to setting up a Medicaid program is that there has to be a provision of federal law that authorizes the state to operate in that particular fashion. And on this slide at the bottom, I include a couple of examples of how states can choose to structure their program. For instance, before CanCare, a large part of Kansas Medicaid operated under a fee-for-service model where a provider would submit a claim directly to the state and the state would pay it for covered services. As you know, under CanCare, we shifted to a largely Medicaid managed care model. And then there's some other authorities that a state can choose to exercise. For instance, you can implement Medicaid managed care under a couple different authorities, including state plan authority, what's known as Section 1915B authority, and the way Kansas has elected to operate it under a Section 1115 authority. And each of these different authorities has pros and cons, and I'll get into that a little bit more in the next slide. So when CanCare first launched, it really changed the way Kansas's Medicaid managed care delivery system in some significant ways. So for the first time, the vast majority of Medicaid beneficiaries were going to be under a mandatory managed care program. Before that, there were some populations that were under managed care, but most Medicaid beneficiaries were not under managed care. KanCare changed all of that. And for the first time, Kansas Medicaid was going to operate almost entirely under a Section 1115 waiver. So KanCare went live on January 1st, 2013, and really drastically changed the way Medicaid was delivered in the state of Kansas. And for, when it went live in January 2013, virtually all KanCare beneficiaries were grouped under the managed care umbrella. The one exception, and you'll see here on this particular bullet, is that long-term services and supports for individuals with IDD, those were added later in early 2014. So there was about a 1-year delay before IDD was added to KanCare. And KanCare were authorized under Section 1115 of the Social Security Act. That's why you'll hear us described as an 1115 waiver. Section 1115 is also known as a demonstration waiver, and it really provides states with the most amount of flexibility to experiment in the way they choose to deliver their Medicaid program. And so that's one of the pros to an 1115 waiver. There really is maximum flexibility for the state. And when you think back to, as I mentioned earlier in the slide, what a significant departure from the way Medicaid used to be delivered in Kansas that KanCare was, it made a lot of sense at the time that the state opted for an 1115 waiver model because we needed maximum flexibility to implement the plan to create mandatory Medicaid managed care in Kansas. So under an 1115 waiver, CMS waives certain requirements that would otherwise apply to a Medicaid program. And that allows the state to kind of demonstrate a new way of business for Medicaid. And our first KanCare waiver ran from January 1st, 2013 through the end of 2017. And we were granted a 1-year extension for calendar year 2018. So we refer to that period as KanCare 1.0, 2013 through 2018. And then we renewed the waiver. That happened in 2018. So KanCare 2.0 went live in January 1st, 2019. And that's the 1115 waiver that we currently operate under. So this is a 5-year waiver operating through calendar years 2019 all the way through the end of 2023. And the way it currently operates, our 3 Medicaid MCOs cover collectively about 95% of Kansas Medicaid beneficiaries. So it's really vast. And we are obligated to comply with what are known as special terms and conditions, or STCs, that spell out the state's obligations to the federal government in exchange for CMS granting us the 1115 waiver flexibilities. So that's a little bit of background on Medicaid generally and on KanCare and where we are. So a hallmark of an 1115 waiver is that it includes a requirement that the 1115 waiver demonstration must be budget neutral to the federal government. And what that essentially means is that it can't cost more for the state to kind of experiment with their demonstration than it would without the waiver. So in other words, the federal government does not want to spend more money on a state's demonstration waiver than they would have spent had we not decided to go the demonstration waiver route. And as a result of that, we are subject to a cap on the amount of federal funding that we can draw down during our 5-year 1115 waiver period. And these caps are calculated by CMS, and they do it in kind of a complicated way. But on this slide, I kind of break it down into the basics. So essentially, CMS groups all KanCare beneficiaries into 2 large categories. The first is adults and children, and that's in the middle of the slide here. And then the second broad category is known as ABD and LTC, which stands for aged, blind, and disabled in long-term care. So in the first category, adults and children, you'll have, CHIP kiddos, low-income kiddos, pregnant women. They all kind of fall into the adults and children group. And then under age, blind, and disabled and long-term care, that's where you see frail elderly, that's where you see the nursing home population, HCBS populations. Those folks fall into the second category. And so once CMS kind of divided up all of our KanCare beneficiaries into those 2 categories, they calculated a per member per month limit on how much we can spend on these two separate groups. And I've included on this slide at the bottom what our current per member per month spending caps are. And these are aggregated over everyone that falls into those two general categories. So for instance, in the adults and children eligibility group, currently we're in calendar year 2021. Whoops, let me scoot back. Hopefully you can see my cursor. This is also known as demonstration year 9. So this is the 9th year we've been under the CanCare 1115 demonstration. And so our monthly cap in the aggregate across everyone who falls in the adults and children category is about $375 per member per month. And the current cap for everyone who falls in the aged, blind, disabled, and long-term care category is a little over $2,700 per member per month. And that is how CMS is going to gauge whether or not our 1115 waiver demonstration is budget neutral to the federal government. So these caps were set by CMS. The state did have some opportunity to kind of argue for those caps to be higher, but ultimately it is CMS who sets those caps, and that's where we currently are. So a little bit more information on how budget neutrality works. The caps that I just showed on the prior slide, those remain the same throughout the life of our 1115 waiver. So those caps are still going to be in place through the end of calendar year 2023, regardless of changes in state law. It doesn't matter what we appropriate towards Medicaid, and the only way that they will change is if CMS agrees to change those caps. And that is a rare occurrence, I can tell you that. And the effective budget neutrality requirement is that Kansas is at risk for any costs above the budget neutrality cap. So after the lifetime of the waiver, CMS will take a look at how much we've spent. And if in the aggregate we go over our budget neutrality caps, all of that extra money has to be paid SGF. So it's important that we stay within our budget neutrality caps. And if it looks like we're going to exceed our cap, CMS can put the state on a corrective action plan. So that's kind of how CMS monitors where we are. And this is important for managing the Medicaid program because really what affects our budget neutrality caps, and let me scooch back just for a moment, these per member per month caps, really what we're talking about is the capitation rates we pay the managed care organizations. That's really what we're talking about. So changes that are made to the Medicaid policy that affect the amount we pay our MCOs per member per month, that is what affects our budget neutrality status. And so at the bottom of this 5th slide here, talk a little bit about what affects budget neutrality. So it doesn't matter if you're talking about SGF or if we're not using SGF. It doesn't matter if it falls under the KDHE budget or the KDAD's budget. If it affects provider rates under CanCare, it has the potential to affect our 1115 waiver budget neutrality. But I also wanted to include some information here at the bottom that there is some CanCare spending that does not affect budget neutrality at all. So for instance, last session, the legislature passed an increase to the protected income level that affects HCBS and PACE participants. We were thrilled by that, by the way, so thank you again for doing that. That has no effect whatsoever on the on 1115 waiver budget neutrality because it doesn't affect the amount we pay the MCOs every month. We were also able to accommodate some provider rate increases outside the amount we paid the MCOs. For instance, there were some distributions from Spark dollars that we were able to pay outside the MCO capitation rate system. And so we were able to shield some of those costs from affecting budget neutrality. But the key takeaway here is that anytime we're talking about a change to the CanCare program, it's important to consider the impact it could have on 1115 waiver budget neutrality. So my last slide here is kind of to give you all an update on where we are with regard to 1115 waiver budget neutrality. So at the beginning of the CanCare 2.0 waiver period, so January 1st, 2019, on paper at least, we had about $1 billion of budget neutrality cushion. And at the end of the waiver, we were projected to come in about $560 million below our budget neutrality cap. However, those numbers were really only good on paper because in reality, there were some decisions that CMS made that were excluded from those calculations and therefore had the effect of artificially lowering our budget neutrality caps. And the first two bullets that I include in this slide talk about two of them. So those of you who were in the legislature around 2017 will recall that there was a bill to increase the MCO privilege fee from 3.31% to 5.77%, effective January 1st, 2018. CMS, despite strong argumentation on behalf of the state, CMS decided not to give us full credit for the full 5.77% and split the difference and gave us credit only for 4.54%. And what that means for Kansas is that it had the effect of lowering our cumulative budget neutrality cap by almost $235 million. So that was a big kick to the state. The second item that's artificially cutting into our budget neutrality cap is that when CMS was calculating the cap for the adults and children category, they were relying on data that was kind of stilted. Those of you who've been in the legislature for a while will remember that around 2015, 2016, the CanCare Clearinghouse had quite a bit of an eligibility backlog. And so the state decided at that time that we were going to focus our eligibility resources on processing incoming new applications rather than processing renewals and redeterminations of eligibility. And as a result, we had some folks stay on the CanCare rolls longer than they normally would have. And those folks tend to be individuals who don't use much in the way of medical services. And what that meant is that the acuity level for the adults and children group were kind of stilted. It was artificially low. And so the data that CMS used to figure out how much money Kansas was likely to spend on adults and children going forward was also artificially low. And the net impact to the state here is that it lowers our budget neutrality cap for that group by almost $140 million over the life of the waiver. So we've been monitoring this situation very, very closely, and our actuaries have helped us to identify some of these decisions that are cutting against our budget neutrality cushion. And so KDHE is in the process of finalizing a proposal to submit to CMS to correct these two errors that I have highlighted on this slide and more accurately project how much budget neutrality cushion we should have throughout the life of the waiver. So, and one thing I do want to point out here is that if we are successful in that proposal and CMS does agree to adjust our budget neutrality caps, that doesn't obligate us to spend 1 penny more on CanCare. What it does is give us more breathing room, and we can worry a little bit less about whether the state will overspend in the next 2 years. So, Mr. Chairman, I will pause right there, and I'd be happy to take any questions the committee may have.
All right, thank you, Sarah. I guess the one question I have, because in the last slide, it looks like we're below the budget neutrality cap. But then on the slide before that, on item number 2, it says Kansas at risk. Mm-hmm. Can you kind of elaborate on that?
Sure. Thank you, Mr. Chairman. And this is what I'm using here when I say Kansas is at risk. That is sort of CMS legalese. So what they mean is by at risk, what they mean is that if we overspend on CanCare, that we will be obligated to cover those excess costs with 100% state general funds. That's what that means. So we've had our actuaries monitoring where we are budget neutrality wise. And so we have kind of a range of estimates of where the state might come in over the next couple of years. But I'm kind of a conservative person by nature. And so I really want to have more wiggle room so we don't have to worry about this, which is why we're submitting the proposal to CMS to correct the errors that were made in setting our caps.
All right, thank you. Representative Wolfmore.
Thank you, Mr. Chair. Thank you for your presentation. I just want to make sure I understand this. So back in 2013, when we did managed care, it was when we went under the 1115 waiver. And and then was renewed in 2018. So as long until 2023, when we could make a different decision, I assume, we have to worry about whenever we're appropriating money, we need to be conscientious of what will affect budget neutrality and what won't. For example, I know first time I heard about budget neutrality last year when we did the CCBHCs, we phased it in because we had to worry about that budget neutrality issue. So as long as we're under the waiver, unless you're asked to CMS gets approved and we do get more of a cushion, we need to be concerned about this. And then how long could that be that CMS gets back to us? So there's a lot there. I'm sorry.
That's okay, Representative. And Mr. Chairman, so CMS, they kind of operate on their own timeline. So I hope to submit this proposal to correct these issues sooner rather than later. So far, we've had a really good working relationship with the current head of the Centers for Medicaid and CHIP Services. He used to be the state Medicaid director for Massachusetts, so he understands what it's like when you're running this type of program. I'm optimistic that they will accept at least one of these two proposals I highlighted on the slide to give us a little bit more wiggle room. And to Representative Wolf's point, I think it is something that it helps to at least ask the question, would this impact budget neutrality when we're talking about changes to the CAN-CARE program? Because there are some things that feed into our budget neutrality that the state does have some control over. And then there's some things that we don't have control over. For instance, we don't have a ton of control over whether we have a lot of CAN-CARE beneficiaries who are hospitalized. You know, if they come down with an illness or accidents, what have you, and they have to be hospitalized. That drives up the per member per month costs. So some things are out of our control, but as long as we're just asking the question, is this something that impacts budget neutrality? If it does in a drastic way, the Medicaid agency might have some ideas on how to protect the state from a budget neutrality perspective.
Thank you, and thank you, Mr. Chair.
Representative Sutton.
Thank you, Mr. Chair. For what you presented to be a dry topic, I think there's a really interesting story here with, in particular, and I know you're already dealing with this, I just like a little bit more color provided to the disagreement provided by CMS with regard to the MCO privilege fee. Raised it from 331 to 577, and they said, we'll split the difference. How did that conversation go?
Thank you, Representative Sutton. And Mr. Chairman, so I was not around when that happened, but I have spoken with my predecessor, who is now the state budget director, as well as other individuals who were around in 2018 when that conversation was happening. And I can tell you, Mr. Chairman, that my understanding is that leadership at KDHE and in the governor's office at the time fought hard to get the best possible deal for Kansas. However, under the prior CMS administration, the CMS administrator was not, she was very focused on cutting costs and curbing the amount of money that states could spend on Medicaid. And so my understanding is that even though their argument made a ton of sense, it had a foundation in Kansas law, that it kind of fell on deaf ears with CMS. And CMS also changed the rules on how to calculate budget neutrality in August of 2018, so 4 months before the CAN-CARE waiver expired. And as a result, the state, we just didn't have a ton of bargaining position at that point. We kind of had to take the best deal that CMS was willing to offer and go with it. But I will say to Representative Sutton's question, a little bit of color commentary here. I have looked into this, and my understanding is that under the prior administration, Medicaid staff, KDHE staff, and the governor fought very hard to get the best possible deal for the state. And unfortunately, this was one of the conditions that we kind of had to accept. But I do think that this is fairly low-hanging fruit, and cautiously optimistic that CMS might be able to revise their calculation of the privilege fee.
Excellent, thank you. Thank you, Mr. Chair.
Committee, any further questions for Sarah? Senator Hawk.
Thank you, Mr. Chairman, and Director Furtick. You may have talked about this when I was out, but I know on the HCBS interim committee that I serve on, and I think a couple other people do here, we had talked about changing the 1115, and one of the House members had mentioned maybe some advantages to going with a 1915B. If I understand your testimony, that's not possible until 2023, or is it possible, and would there be an advantage to us changing our waiver so we're not in this budget neutrality box?
Thank you, Senator Hawk. And Mr. Chairman, that's an excellent question. So we have been studying what the state's options are. You know, our 1115 waiver expires at the end of 2023. The state has to decide which direction we go forward. And, you know, right now, the 1115 model, the budget neutrality obligation is kind of like a black cloud hanging over the state's Medicaid program. And, you know, just on a philosophical level, I don't like having to ask the feds permission for the state to manage the program the way we wish to manage it. So, you know, that does drive me a little bit crazy. But so we are researching what other possibilities could be for CanCare going forward. And as I mentioned in one of the earlier slides, there are other ways that we could essentially have the same program we have now, just under a different source of federal authority. Now, if the state were to decide to shift to a 1915B waiver or something like that, there is a wind down process that the feds require for an 1115. It takes about a year. We have to provide public notice and opportunities for comment if we're disbanding the 1115. So there's some rules that we have to follow, and it would probably take a year to transition. Also, if we were to exit the current 1115 waiver early, our budget neutrality status would be determined based on where we were as of that last day that the waiver was operational. And my understanding is that most of the savings and most of the cushion that we expect to have from our 1115 waiver, that's going to be generated in the out years. So 2022, 2023. So if we cut off our waiver early, some of that extra cushion from the out years, we wouldn't be able to benefit from it. But we are looking into what other options there are and intend to have some good conversations with the governor's office, with the legislature, to see what makes sense for the state going forward. Because at this point, you know, my opinion is that Medicaid managed care, CanCare in Kansas, it's no longer a pilot program or a demonstration program. You know, we're on year 9 of Medicaid managed care in Kansas. So this is a mature program. And I think it is worth asking whether a demonstration model with strict federal spending limits, it really meets the state's needs going forward.
Thank you, Mr. Chairman.
Committee, any further questions for Director Furtick? All right, seeing none, thank you for being here. And we'll go ahead and move on to the next topic in regards to Medicaid. And that is something we've already been discussing this morning, actually with Megan, and that is the federal medical assistance percentage, the FMAP adjustments. And so I'll now turn it over to Amy Penrod with the Aging and Disability Community Services and Programs Commissioner with the Kansas Department of Aging and Disability Services. Welcome to committee.
Thank you, Mr. Chair and members of the committee. Again, my name is Amy Penrod. I'm with the Kansas Department for Aging and Disability Services, and I am here to give you an overview of our plans for the FMAP enhancement that is afforded to us by Section 9817 of the American Rescue Plan Act. So starting on my slide 1, Section 9817 has provided Kansas a unique opportunity based on enhanced federal funding for HCBS through some one-time 10% increase to the share of state Medicaid spending contributed by the federal government. So this one-year increase in federal matching funds will result in new time-limited dollars that can be strategically invested in HCBS services in Kansas, and those investments can happen through March of 2024. So Kansas is required to use the state funds equivalent to the amount of federal funds attributable to the increased FMAP to implement or supplement the implementation of one or more activities that enhance, expand, or strengthen home and community-based services under the Medicaid program. So KDHE and KDAD submitted our joint FMAP enhancement spending plan to the Centers for Medicare and Medicaid Services on July 9th of this year, and we are still awaiting full approval of that plan. CMS has provided us a partial approval, which essentially acknowledges we received your plan. They asked a couple of follow-up questions. We've responded, and now we're waiting. So CMS did require all states to provide the following assurances: that we will use the funds attributable to the increased federal match to supplement and not supplant existing state funds for home and community-based services, that we will use the amount attributable to the federal increase to implement one or more activities that enhance and support home and community-based services, that we will not impose stricter eligibility standards or methodologies for the HCBS programs, that we will not, or that we will preserve the HCBS services themselves, including the amount, duration, and scope of those services that were in effect on April 1st of this year, and that we will maintain HCBS provider rates at a rate no less than those that were in place on April 1st. So based on our calculations, KDADS is expected to draw down approximately $80.3 million in additional federal match. And KDHE is expected to draw down approximately $4.9 million in additional federal match. And that is based on a predetermined set of services for which we are allowed to draw extra match funds. Slide 2. Okay. Upon learning of the opportunity to invest the additional federal funding or additional funding into HCBS, KDADS began meeting with our stakeholders to compile a list of potential projects that would allow the state to strategically position its programs and services for the future. So KDADS met with advocacy groups, service providers, our educational institutions, and other state agencies between March and June of 2021 in preparation for submission of our plan. As the number of potential projects far outsized the estimated funding available for investment, the state leveraged the following principles to determine how to use the available funding. So we wanted to be sure we could maximize the benefit to Kansas citizens, that we could invest in lasting impact and change, to ensure flexibility to meet evolving needs, and to fully utilize all federal funding that we were afforded. So our long list of ideas was really narrowed down into 3 priority investment areas based on the size of need and alignment to principles. And so these 3 priority investment areas are workforce, employment, and access to care. On slide 5, I have a listing of our kind of final investment portfolio as submitted to CMS in July. And it has 12 initiatives, and I will go into each one of these in a little bit more detail. As you'll see, they are broken up there between the workforce, employment, and access to care. It should be noted that the state will be required to report quarterly and update both its narrative, kind of our explanation of what we're doing with the funding, where we're at in the process, as well as our spending plan. And so the status of the funding spent, that all has to be updated on a quarterly basis going forward. And this process will allow the state to modify its plans as necessary to ensure we can accomplish the priorities presented in our initial plan. So as I had mentioned, the first category, and probably one that will resonate with a lot of you and what you're hearing about workforce. So our first set of projects deals with attempting to stabilize and create or set us up to create a more sustainable workforce in the healthcare industry here in Kansas, particularly those that are working with our home and community-based service waivers. So recruiting and retaining a qualified workforce is important in any industry, but it's critical to the independence and well-being of the individuals we serve in the home and community-based service waivers. So retention incentives and recruitment bonuses, things like robust training opportunities, aim to bring direct service workers into the field, and then further exploration of direct care service worker career ladders can help build a pipeline for future workforce needs. So the focus of the workforce bonus program is really to stabilize the existing hardships that are going on within our system right now as with regard to workforce. Kansas currently ranks 34th in direct service workers per HCBS waiver participant. We do rank 42nd in direct service worker wages. And we have found that on average, for every $1 more a caregiver is paid, annual caregiver turnover decreases by 3%. So the attempt with this program or this initiative will be to kind of give a shot in the arm to our direct service workers and that stabilize that workforce a little bit. Is this a silver bullet? Will this cure what ails the system? No, it will not be a cure-all. We hope that we've got to get started. We've got to do something. And this is one way to get some quick funding into the hands of our direct service workers, entice individuals to choose a career in direct service work with our HCBS participants. And so, KDHE continues to meet with our stakeholders. We meet with our advocates, our providers, associations, and participants. And overwhelmingly, we are hearing greater desperation with the workforce crisis in the state. Providers are having to consolidate service locations or close to new referrals due to lack of staffing. So one provider actually recently reported only being able to deliver an average of 41% of the authorized service hours to its clients due to a lack of staff to provide the service. So providers really are struggling to recruit and retain their employees. Workers in the field are burning out, and participants are desperate for these critical services. So we at KDHE are continuing to look for actionable ways that we can get resources to the system to support our participants, the workers, and our providers. And this workforce bonus recruitment and retention program or project is one of those ways that we're proposing. The next project is workforce training grants. For training, we are hoping to improve the quality of care by ensuring our direct service workers have the knowledge, skills, and abilities to provide the support. There are a lot of studies and a lot of information stating that if a worker feels more prepared and trained for their position, they have better job satisfaction and will be more likely to stay in their job. And so this project would propose to allow providers to apply for training funding, and that can be very flexible depending on what the needs are in their particular specialty within HCBS, and allow them to ensure that their workers are fully developed, or we're investing in them. The third initiative within the workforce category is a career ladder study. And so what we're proposing here is to design a career ladder for our direct service workers here in Kansas that will allow those direct service workers to have a clear path for promotion, that we are investing and our providers are investing in those workers, and hopefully entice them to stay in the profession, get promoted, earn higher wages, and help us with that workforce need. And so this particular project would be a kind of one-time funding to design that career ladder for our staff. The next set of initiatives is under employment. And there's one project under this currently, and that is really creating a roadmap on how to make employment first a reality here in Kansas, and to address employment gaps between those with and without disabilities. So the availability of competitive integrated employment for individuals with disabilities is the aim of the overall Employment First initiative. And Kansas intends to utilize this funding opportunity to study and create a roadmap to a complete and robust implementation of Employment First. A particular focus will be on the supported employment service offered on the IDD waiver. In addition to looking at the rates that we are currently paying themselves, this project will also provide us as a state agency and as the state some recommendations and information on alternative provider reimbursement models for supported employment services, with the goal of creating a robust and sustainable provider network to assist with these services. Next, the third category of investment was access to care, and there are quite a number of projects within this category. Initiatives in this category are intended to expand accessibility to home and community-based services through studies of the HCBS waiting lists, targeted case management models, and gathering information about justice-involved individuals with disabilities. So increased access to institutional transition services and training for parents and providers working with individuals with intellectual and developmental disabilities and behavioral health challenges are planned to be addressed. The projects under the access to care are targeted to both strengthen the HCBS service delivery system and to provide services directly to individuals who are receiving services through one of Kansas's 1915C waivers. So the first item on our list is to add some temporary staff to the Department for Aging and Disability Services on my home and community-based service team to increase and maintain the number of compliant providers regarding the final settings rule compliance, or final settings rule from the Centers for Medicare and Medicaid Services. The state is required to come into compliance, and all providers of HCBS services are required to come into compliance by March of 2023. And we have had a lot of great participation and uptake from our providers, but we want to be sure we can assist those that need help coming along and maintaining their status as a home and community-based service provider, and also maintaining that compliance going forward, as that will be a requirement to receive federal funding for home and community-based services. The next project under Access to Care is a waiting list study, and this is probably one I'm the most excited about out of all of them. The workforce bonus program is really important to me. It's probably number one, and this one comes in a close second. We have in the state approximately 4,500 Kansans on the waiting list for the intellectual and developmental disability waiver, and another 2,000 on the physical disability waiver. We don't know as much as we could about the individuals on the waiting list, particularly on the IDD waiting list. While the state can track basic information, we do not have a process established to track information about their current needs and the anticipated needs during the next period of time to be able to predict what individuals will need in services over the next 5 years or more. Currently, for the individuals on the IDD waiting list, that wait is for the individual that's been on the waiting list the longest. They've been on the waiting list for 9.5 years. And so as individuals are placed on the waiting list, they do have an assessment at that time. They are eligible for services. Their needs are known at that time. But as you can imagine, a fair amount can change in 9.5 years. And so what we're proposing to do with this study is to assess the needs of the individuals that are waiting, be able to gather information about the types of services that are most needed, and figure out ways with that information to perhaps develop an alternative model, perhaps a community support waiver, something a little bit different than what we have currently. Right now, our waiver is a comprehensive waiver. So you get, if you qualify for the waiver, you get potentially, based on your need, you get a menu of services, and we pay a capitation rate for that. There could be lots of other ways to kind of tackle some of the individuals on the waiting list and get folks services, particularly if they don't need some of that menu. We could develop a smaller menu of services for those individuals. So bottom line is this study will provide us a way to make data-driven decision-making and plan effectively and efficiently for those people on the waiting list and lead to better outcomes. So we want to support capacity building and further implementation of the Kansas's Employment First Law, and we really think that this project will have a lot of benefits. We will have the ability to document the needs of people coming off of the waiting list and to potentially identify and prevent crisis situations that lead to immediate service needs. The ability to predict the service needs of the system and the CDDOs, so kind of at both the system level and the CDDO level currently, and up to 5 years out, so that planning for appropriate services can be implemented. The ability to track important trends, such as health and employment status trends of people on the waiting list statewide, to better understand their existing support needs. The ability to monitor and understand the support needs, which could potentially inform planning and reduce the number of folks on the waiting list. And bottom line, the ability to make data-informed decisions about system funding needs. So we feel like this investment will allow the state to be better equipped to make the data-driven funding decisions, and providers will be able to develop data-driven strategic plans. So the next project is with regard to transition services. So some of you may be familiar with Money Follows the Person. That was a federal grant program that allowed assistance for individuals wanting to transition out of an institutional setting and onto the home and community-based service waiver. we want to provide some additional investment in transition services. Currently, the Money Follows the Person grant in Kansas we are in the process of reapplying for that grant. It had, the feds had kind of started to shut that program down, and now there seems to be a new interest in it. So we are currently working on that, but this transition service project will allow us to address some of those needs of individuals wanting to transition out of facilities. The next is a targeted case management study. The goal of this project is to help us develop, in concert with our stakeholders here in Kansas, to develop a system, kind of revamp our targeted case management model. Our individuals on the IDD waiver will tell you, and I will tell you, that targeted case management is a very valuable service in Kansas that helps folks with a number of items and help navigating the system and provide some advocacy for them. We have had several conversations with CMS over the last few years about our current model and some of the concerns about conflict of interest that exist within that model. And so there has been a gentle pressure at this point to find ways to mitigate that. This study would allow us to work with our stakeholders to develop a system that not only addresses that conflict of interest, but also perhaps eases some of the burden on our targeted case managers with the administrative portions of their job regarding billing processes and paperwork and things like that, because that's pretty significant at this point. The next project is mobile crisis. So as many of you may know, there is a big initiative to build mobile crisis services in the state. And in doing so, there has been a recognition that there may need to be some additional training and additional availability of individuals who can assist with individuals with intellectual and developmental disabilities. Their needs in a crisis may be different than someone who maybe has I don't want to say just a behavioral health issue, but it certainly adds a little different flavor to it. So we want to build upon the mobile crisis infrastructure investments that are already underway and ensure that we have respondents that are equipped to manage our IDD participant crises. So this is really to fill kind of an existing service gap in our system. The next, and I promise we're getting close, the SIM consultant item. It is a opportunity to bring in a SIM consultant, which is a sequential intercept model, and some of our localities here in Kansas have used this model. I know some of our partners in Sedgwick County have used it with regard to their intellectual and developmental disability system. But they are looking to identify, it brings together professionals from all across different fields in Kansas. It would bring our professionals together in criminal justice, social services, really a wide variety of individuals to assist us in identifying gaps in services that would kind of strengthen that continuum of care with a focus on justice-involved dual diagnosis individuals with disabilities. So individuals that have a developmental disability but also have behavioral health needs, and those that have some interaction with the justice system. So that would be a kind of set us up to identify the gaps and then make proposals on how we could implement fixes to those gaps. The next one is some behavioral management training. This is an issue that has been identified as a need within our system. Family caregivers of children with disabilities do report, some difficulty in knowing exactly how to handle some of perhaps the extreme behaviors. And what we're really looking at here is a way to prevent foster care placement and PRTF admissions to keep children in the home. And so to the extent that we can provide our families with more support in that arena, we think that that can have a really significant impact on not only the families and the children, but also on our systems as well. So this will be essentially a pilot, I believe, where we'll be spending approximately $2 million on this particular initiative. And with those outcomes, then we'll be able to demonstrate what we may be able to do on a longer term basis. And then the final KDADS project is remodeling grants. And so as I had talked about earlier with the HCBS settings final rule from the Centers for Medicare and Medicaid Services, our providers of HCBS need to be compliant with that settings rule by March of 2023. And for some of our participants, particularly assisted living facilities and those that have maybe a little bit more of an institutional flavor currently, they may have some barriers to coming into compliance that could be remedied with small or moderate capital improvement projects. And so this pot of money here would be proposed to include capital investments. They are permitted under Section 9817. We would provide grant opportunities to our providers that demonstrate the ability to come into compliance with the final settings rule, but for the need of these projects. And then finally, I can't speak in depth about a lot of these, but there are several KDHE-sponsored projects that are a part of our FMAP enhancement plan, and that's on slide 22. Those are listed. So they have 5 distinct projects that they've proposed. One is the community health worker funding, and that would be incorporating community health workers into the Medicaid program to connect beneficiaries with available healthcare services and social supports to help address social determinants of health. MCO housing investment incentives, which would allow KDHE to develop an incentive program to allow MCOs to earn additional bonus payments for creating housing investments here in Kansas. The third is some MMIS work for a Pondera solution, which essentially is an IT infrastructure project that would allow the Office of Medicaid Inspector General and the Medicaid Fraud and Control Unit at the AG's office to more effectively mine data from our Medicaid managed care information system to help assist in prevention of fraud, waste, and abuse. And then HCBS provider training. So this would be training primary care and dental providers in the Medicaid program to better serve our HCBS participants. And hopefully if they feel better prepared to serve our participants, they would be more likely to take our participants. In particular, dental is really difficult to find dentists that are willing to work on some of our participants, particularly sedation dentistry and things like that are difficult. And then finally, the KDHE has proposed a evaluation of the STEPS pilot program, and that is the employment program that serves individuals on the IDD, PD waiting lists, as well as individuals with behavioral health issues, and helps provide supported employment to them. So that project would consist of an evaluation of the pilot to inform future iterations of CanCare. And I believe I will stand for questions at this time, and I hope I'm not overstepping, but I believe the Medicaid director is on the line too. If you had questions about the KDHE project, she may be able to assist me with those.
Thank you, Amy. Questions for Amy? Representative Sutton.
Thank you, Mr. Vice Chair. Vice Chair, would it be? Acting Chair? We'll go with either one. I do have a few questions, and if I get long-winded here, or if I take up too much time, feel free to use the hook and pull me out. But first off, going back to the workforce issues themselves, you mentioned direct service workers. Now, pretend like I'm new to this, and what is that occupation path? How do you become a direct service worker? What specialization do you need?
There are not a lot of requirements to become a direct service worker. An individual, depending on the age requirements, which vary a little bit from waiver to waiver, essentially you need to pass a background check and then have the training that either the provider agency, or if you're working for an individual who is self-directing their services, the training that individual provides.
Okay, so they're not like on a nursing path or anything along those lines?
Not necessarily. I mean, they could be that. Sometimes we have college students, things that are in a nursing program, they'll work in this path for a little while until they graduate. But that's, right now there's really not a defined career path for these individuals.
Okay, so it's not social workers, not nurses, it's just whoever shows up to do the job with training, obviously.
Yes.
Yeah, right, okay.
Yes, it could be.
All right, very good. Well, that actually took out a couple of my other questions regarding that. I do want to go, regarding the career ladder study, what sort of a step program are you seeing, or are you envisioning in your mind right now?
I'm envisioning there are some models that are being implemented currently in the state, in particular with the intellectual and developmental disability service system. Sedgwick County has been partnering with Wichita State University and some of those other community colleges to talk about and kind of work on I think they call it a badge program. So as you develop certain proficiencies and skills, you would kind of get I'm not sure credential is the right word, but you would kind of get a badge or a credential that would potentially then allow you to qualify for a higher wage as you progress through that training program. So that's the type of program I'm envisioning. I can say that what we're looking at and what we want to do is broader than the IDD system. It would be across all the HCBS waivers. So we would want to have our stakeholders very involved in what will work for their providers and their participants and really bring folks together. Because I think, we can all agree that we know Kansas knows Kansas. So while we need a little bit of help and guidance with some of the development, we want to be sure our stakeholders are at the table to inform that process.
Excellent. All right, I kind of like that answer, by the way. Okay, you knew this had to come up. The waiting list study, 9.5 years. What kind of service is that person waiting for?
They are waiting for, depending on their needs, they could be waiting for adult day service. They could be waiting for employment services, although we do now have the STEPS program that's a pilot program that they would likely qualify for and could benefit from in the meantime. Residential services, so being able to live independently or in a residential setting with that assistance. Let's see, there's specialized nursing care. There's a whole host of, I believe, 14 different services that are provided on the waiver. Now, I will say a lot of the individuals that are on our waiting list, approximately 70%, are already qualified for regular Medicaid. And so they would receive their primary care, prescription, the regular Medicaid package would be available to them. They just don't qualify then yet for those, or they qualify, but we don't have the appropriation or the capacity to serve them for the home and community-based service waiver package.
Okay, and the study that you're talking about would put a finer point on what exactly is being required? Maybe they don't need all 14 of those services, is what I'm saying.
So some of our stakeholders, and particularly, I believe, Interhab, testified at the special committee for the IDD waiver that some states utilize a community service waiver model, and that community service waiver model is intended for individuals that perhaps reside in the family home and they need personal care assistance. They may need other supports, but maybe not they won't need residential because they're in the family home. They won't need day services because likely they're in school. So they wouldn't need the full package of our comprehensive waiver. And in doing so, if you have a waiver that has a little bit more limited menu of services, then very likely, your capitation rate, the rates that you would pay then for individuals on that waiver would be less. So it could be an efficient way to make sure that people have the services they need. We're paying less
Right,
per
and not paying for the
person per month.
services they don't need.
Right.
Gotcha, okay. And I don't think I've scribbled anything else down here, so I think that was all the questions that I had. All right, very good, thank you, and thank you, Mr. Chair.
Senator Hawk.
Thank you, Mr. Chairman. Amy, thank you for your report. Having not dealt with this area for several years since I was in the House, I'm very impressed with what looks to be very comprehensive, and it seems like many of the things that you're looking at with this project interfaces with what our interim committee discussed in terms of a lot of the concerns nearly all of us had a consensus about that needed to be addressed. I do have one thing that my CDDO suggested to me to look at, and I don't know if it could be included in this, and I'm not sure it's doable, but it has to do with capers and hiring retired people who are on capers. And there's Representative Johnson would know a lot about this, but there's a requirement that the agency pay a surplus for hiring people who are on capers. My recollection is in Ways and Means a couple years ago, we added a provision that let the new employees actually not go on capers initially so they could have a higher starting salary, hourly wage, and the agency didn't have to do the match. And so I'm not sure, like I said, I'm not sure it's a great idea, might be a good one to pull, because I know there's just a labor shortage everywhere, but especially in this area. It might pull some people who are already on capers who might want to come back in and help the people who are clients if the agency didn't. And I think is it 19% that the agency has to pay hiring somebody that's there. So if that's possible, I think that might be one of the things to look at in the workforce and see what the impact is on capers and whether or not that's an idea that might get us a little bigger labor pool to draw from, where people would have an incentive to come to work after they'd retired.
Okay,
So,
thank you.
Just a thought. Thank you, Mr. Chairman.
Representative Wolfmore.
Thank you, Mr. Chair. And I'm not real close to this issue, and I think I got the flavor through your presentation, but is the main reason the waiting list is so long is because the lack of direct service providers? Does that cause the list to be that long?
It's probably two or threefold. There's a couple of reasons. Number one, we have a kind of an appropriation. The HCBS waivers are not included in caseload consensus that you were talking about earlier. So the agency comes to the legislature to ask for that funding. And over the years, then we've managed our waiver within the funding that's provided. So certain years, you've appropriated additional dollars to be able to add individuals to the wait list to increase the number of people we could serve. There's the funding. Second is the provider and system capacity. So over the years, I believe our providers would say, and I think I can agree with them on this, that our provider rates have kind of lagged in a lot of areas. And that then does not allow for a provider to anticipate the growing needs to kind of build capacity. And so that caused kind of the system to stagnate a little bit. And then third is just the general workforce crisis. That has been an issue within our system for a very long time. These direct service worker jobs come with a lot of responsibility. And if you're making $10 an hour, $11 an hour, it can be a lot of responsibility. And when presented with an opportunity, particularly now, to the billboards down the street, at other retail or other service industries, you can work there for more with less responsibility. And so that does exacerbate the issue quite a bit. I will just say that all those things kind of work together to create the issue. If the legislature were to appropriate the money that we would need to take the 4,500 people off of the waiting list tomorrow, our system could not serve that many more people. So we really have to tackle this in a number of ways, being able to anticipate and build the system capacity and fund those providers, and then fund their per member per month, the cost of them being on the waiver.
And just to follow up, and I don't know if this is accurate, but what I've heard in the past is that you can't really get rid of the waiting list because in anticipation of knowing you're going to have a long wait, and I can't blame people, they sign up for services maybe before they need them. Is there any truth to that or not?
Well, so at the time an individual is placed on the waiting list, they are eligible. So they meet the level of care requirements. They could, at that time, benefit from and they qualify for services. Is it true that, perhaps a parent of a 5 or 6 year old, they know that there's a 9.5 wait, and maybe they're doing pretty good with maintaining and providing services in other ways. Do they, get on the waiting list? Absolutely. They're doing the best they can at the time, knowing that the need, the urgent need will come sooner or later. But we don't place individuals on the waiting list that don't qualify. So all of these individuals qualify.
Thank you. That's very helpful. Thank you. Thank you, Mr. Chair.
Senator Billinger.
Thank you, Mr. Chairman. Thank you, Amy, and thanks for working on this. And it is a very important work, and it's, you hit the nail on the head. We've been struggling for a long time to get enough help and keep the help, and with what's going on today, I hope that you folks will send word back to the feds that, they're making it even worse. With inflation, you can't go to the grocery store now and things are costing so much more, whether it's gasoline, whatever. not doing anything about inflation is hurting us, and it's going to hurt trying to keep these folks employed. You know, we tried to add a little additional income for these folks, tried to get them competitive with Chick-fil-A, and now they're all raising their rates again, and it's just a vicious circle. But I hope you let them know that these mandates and inactivity on inflation are killing us.
We do regularly communicate what we're seeing here in Kansas. It's on several opportunities, you know, and let them know what we're seeing and what we're experiencing.
You know, and I'm getting a lot of emails. I'm sure all of us are, but you know, when you get emails from someone that's worked at a rest home for 30 years, and they said, we're just going to quit because we're not going to get the vaccine, that doesn't help anyone. So please relay those messages. Thank you.
Representative Johnson.
Thank you, Mr. Chair, and echo the Senator's comments on thanks for your important work. And I know it's not easy to come up with the list of things, but what did stand out to me is there are several studies that we're doing, and I'm sure that there are even more that would be good to do. But I'm wondering about the capacity of people to implement the changes from the number of studies and whether they are different departments, or if there's an opportunity to sequence some of the studies in the time frame to 2024 based on priority. If we already know some of the things we want to do with regard to the waiver, how do I target that? The studies that I've participated in have had some value when the stakeholders and those doing the work were engaged in it, versus when I got the consultant's report, which I read and can sometimes become a shelf decoration. But sometimes those changes aren't free. So when we come up with the list of what we would like to do to address the waiver, there may be a few things standing in the way just to execute that. And that may not qualify for the funding, but I'd like to set ourselves up to get value from the study and not only have gained some learnings, but no specific changes as we work through that period. So I'm sure that folks have talked about that, et cetera, but that was my concern as I looked at the many things that are on our agenda.
Mr. Chair and committee, yes, I share that concern. I want to be sure that the studies yield not just a document that sits on the shelf, but it provides us some actionable steps to take that will lead us to where we need to go and where we want to go, and to have our stakeholders participate in those. There is not a single one of these initiatives that wasn't brought to us or supported by our stakeholders. And so we fully intend to maintain their involvement as we work through these. While we may need some help administratively in pulling data together and kind of analyzing that data, we fully intend to have our stakeholders engaged because, as I said, you know, before, Kansas knows Kansas, and we want to be sure that we're coming up with solutions for Kansas that'll work here and that we can implement.
And thank you. And that staff has the capacity to deal with change, which is difficult, and kind of has that expectation going in to say, the study is not the end, it's the beginning, and how do we have capacity to embrace that and work through it?
Yeah, so we will, as you saw on one of our items, was bringing in some short-term internal staff to help implement these projects. I do think that you will see, and I don't think I'm speaking out of turn here, but I think you will see in future budget requests for KDADs some modest asks for staffing to be able to maintain the momentum that we're going to be gaining with these projects. Right now, I would say we're pretty strained with our day-to-day operations and trying to effectively manage 7 home and community-based service waivers. So we know that we have a long way to go to get where we want to get with these things. These are all things that our stakeholders have asked for. We're ecstatic that we have this funding opportunity because that doesn't come along every day. And so we are committed to, utilizing all of the resources we have at hand to move these forward. So I think as we move down the path, you may in the future, as this funding dwindles and we're able to demonstrate the benefit of these projects, you may see requests for sustained funding. But we realize that this funding right here is one time and short term.
Senator Hawk for a second time.
Thank you, Mr. Chairman. Sorry for a second time. One of the things we talked about was the rate caps. And I think there are 14 services in HCBS. Is that right?
Yes.
Are we going to get at that? And as my recollection is, those have been sort of frozen or capped out for, I don't know, 10, 15, 20 years at those rates. Maybe that's too long, but.
So there are 14 services, I should say, for the IDD waiver. There are other menu of services for the other HCBS waivers. The rates for certain waivers have increased, marginally over the years with additional appropriations. Several of the services and the rates associated with them have been stagnant for quite some time. The FMAP enhancement funding does not address the rates themselves. It was very clear that we should not be committing the state to any ongoing obligation with regard to these projects. And by using some of it or all of it to do a rate increase, we would have made it very difficult for the legislature not to continue that. So what we have attempted to do with these projects is to demonstrate, where different types of investments will be beneficial and to show us where we need to invest, particularly with the IDD and PD waitlists, so that we can bring that information to you and say, here's some solutions, and we can estimate costs, and those decisions can be made from there.
So is increasing those caps a function of the legislature and the budgeting process?
The rates, the Medicaid floor rates would, yes, that would be a function of the legislature to appropriate money for those rates.
Then we'd have to ask that budget neutral question.
Yes, that would be a question to be asked as well, yes.
Thank you. Thank you, Mr. Chairman.
All right, I'm not seeing any other questions, but thank you, Amy, for being here. And obviously, you did your presentation for the HCBS special committee that Senators Hawk, Billinger, and myself sat on. And one of the things that we talked about at length was the wait list. And we had a presentation or a discussion in regards to the state of Louisiana, which is kind of shocking that the state of Louisiana be leading the nation on this. And further discussion with that, because they have eliminated their wait list. But after further discussion, it's not really an elimination of the wait list. It was a shift to other services, and they basically called it something else so they could say they eliminated the wait list. But the other staggering information was that all of our surrounding states have a considerably less amount of individuals who are on their wait list. So why is Kansas kind of in this anomaly in the Midwestern part of the nation? And the other thing, we talked about the employment of the providers, but also we're impacting the employment and the livelihoods of parents. We had a lot of testimony, and in fact, I recall one where right now her son, his medical expenses, namely his prescriptions, would be $24,000 a month if she did not receive Medicaid for her child. And so she has to make sure that she doesn't make enough to be taken off Medicaid while she's waiting to be on, for her son to be accepted and taken off the wait list. And so we've impacted her life because she has to watch how much money she makes a year. She's living with her parents. She's a single mother. And so we're impacting a lot of lives. And that was one of the recommendations was to the legislature to let's try to have a plan in place on expediting and getting people off of the wait list. Maybe not eliminating it, but getting those individuals taken care of so we're not impacting personal lives of individuals. All right, thank you, Amy.
You bet. Thank you.
All right, we'll move on to the October State General Fund receipts, and we're about a half hour late, so I apologize, Edward. But if you could go ahead and give us the update from the month of October.
Sure, I'd be happy to. Thank you, Mr. Chair and members of the committee. My name is Eddie Pinner from Legislative Research. You should have in front of you a two-page document. It might be one sheet, front and back, one page of text, and then one page of a table that is the State General Fund receipts for the fiscal year to date for July through October. Unlike Megan earlier with the human census caseloads estimates, we have not completed our consensus process for the revenues side yet, and so I don't have the full revised estimates to give you. Our meeting is scheduled for Wednesday of next week, the 10th for that. This year, usually we have those very close together, those meeting dates. This year, it just worked out with people's schedules that Human Services was on about its earliest possible timeline and Revenues was on about its latest possible timeline, so there was kind of a disjoint in those meetings. So this will be a little quicker than it otherwise would have been since I don't have the full estimates to give you, but I will walk through the fiscal year to date to October. I'll speak briefly about kind of the October only and the individual monthly estimates, and then I'll also briefly comment on the receipts relative to estimates since we last estimated back in April. So first, just kicking off with the fiscal year to date through October, you can see that the total receipts are $438.3 million or 18.9% ahead of the estimates. Total taxes makes up actually a little bit more than 100% of that, as it is $440 million or 18.9% ahead of the estimates. Individual income makes up the largest single share of that, and it is $201.5 million ahead of the estimates. Corporation income is $136.6 million ahead of the estimates. And so the kind of income taxes make up $339 million of that $440 million total taxes. Another $91 million of that margin comes from sales and use. As you can see, retail sales is $61 million ahead of the estimates, and compensating use is $30.1 million ahead of the estimates. The only other category that is really worth commenting upon is the severance taxes. You can see oil and gas severance taxes combined to be about $6.7 million ahead of the estimates to date. As obviously energy prices have been higher than we imagined they would be when we met last April. So speaking specifically to October and individual months, October's individual number was about $46.6 million ahead of the estimates. The bulk of that, of course, is in withholding payments. We don't estimate the individual components of the taxes separately. We just do an aggregate estimate. But when you look at it on a breakout of those individual components, it's hard to attribute this to anything other than withholding. Withholding beat the prior year amounts by 11.9%. The bulk of October receipts come in the form of withholding, as there isn't an estimated payment date or a return date due in the month of October. And so it's hard to attribute that to anything other than withholding. Corporation income tax beat October by $25 million. That appears to be attributable to estimated payments. Those have been strong throughout the fiscal year, and as withholding has been on the individual side throughout the fiscal year. And then sales and use beat the October-only estimates by $17.7 and $12.6 million. One of the things I would note in terms of the individual monthly amounts is that beating the estimates has been a pretty consistent amount from month to month. This isn't a situation where we beat it by a huge amount early in the fiscal year and it's just kind of carried on. In July, the total taxes beat the estimate by $60 million, in August by $113.6 million, in September by $162.2 million, and in October by $104.2 million. We really are steadily ahead of our estimates, which probably indicates something about this having some sustained aspect. This isn't a one-time large blip that we missed by in our April estimates. It's kind of a systemic miss in those estimates, which you can see even more so when you look at the kind of combined total of the amount that receipts have exceeded the estimates since the April estimate. You might recall fiscal year 21, the total taxes exceeded the estimates by $758 million. When you combine that with the $440 million that total taxes are ahead of the estimates through the first 4 months of this fiscal year, that gets you to about $1.2 billion over the course of those 7 months. And so with all of that said, I'd happily stand for any sort of questions that you might have.
All right, committee, have any questions for Edward? Representative Johnson.
Thank you, Mr. Chair, and thanks for the overview. And you may have even said these two. I was curious, the individual income for October is listed, and it may be listed for the corporate and the sales tax. I was wondering how much of those were each ahead by for October.
For October specifically, individual was 46.6, corporate was 25.0, sales is 17.7, and use is 12.6. Those are all millions of dollars. The only one that is specifically listed in the memo is the individual income. Everything else you would have to do some math with the charts here relative to the charts in previous months' memos, which I imagine those sorts of questions might come up, so I had those handy.
And this kind of goes on to the previous speaker when Senator Billinger was talking about inflation. Obviously, we've been having like a sidebar conversation in regards to the severance tax on oil and gas, which you mentioned. The energy prices have been a lot higher than the anticipated price was thought to be in April. So that explains that. But in regards to individual income and also retail sales, could the inflation have a variable in the increase in those amounts?
Absolutely. Inflation is certainly a contributing factor to those. It would be hard to say that it is exactly,
it's not the only variable.
Right. It's not the only variable, but absolutely inflation contributes to those. It contributes to sales tax very directly as the sales tax is based upon the price that you pay when you purchase things. And so if that price goes up as through inflation, then the amount of tax you pay goes up as well. It impacts the income taxes as well, but obviously it's less direct. It's just a factor of those prices flowing through and impacting things, and employers being required to raise wages because of inflation elsewhere. It certainly contributes to it. It contributes more directly on the sales and use than it does on the income and the individual income and corporation income, but it contributes to all of them, of course.
Committee, any other questions for Edward? Senator Billinger.
Thank you, Mr. Chairman. You mentioned on the individual that primarily withholding in that. Isn't October too for extended returns to be paid, I think?
October is when if a taxpayer gets an extension when their return is due. However, the payment associated with that return is still due back in April when they, or in the case of this year, it was May, when they file for the extension. It's just that the exact filing itself is what is delayed. So we do typically see a small bump in regular receipts, non-withholding type receipts in the month of October. As they kind of reconcile those, there usually is a little bump, but it's not a big bump. It's not the sort of filing and return payment that we see in the months of March and April.
Thank you. I'm just curious how that worked out. Thanks.
Mm-hmm. All right, committee, any further questions? All right.
Thank you.
We're back on schedule now. Thank you, Edward. All right, the next individual we have, and I see that Secretary Lorenz is here with the Kansas Department of Transportation, and she's going to be giving us an update on the Ike Transportation Plan. So, good morning, Madam Secretary.
Good morning, and thank you for the opportunity to give you an update. And I'm checking to see if we're going to have the slides. And if not, if you have them in your packet,
We do have in our packet.
we can just go from that if you guys are good with that.
sounds fine.
All right. All right, well, good morning. And we'll go to page 2, please. So a quick introduction to Ike, the Eisenhower Legacy Transportation Program. It's built on 3 principles, 3 primary principles. First being partnerships. We want to work closely with communities, cities, and counties, and our private partners, including the engineering firms and contractors and the legislature. Transportation is a team sport, and it only works if we're working as a united team. When we work with communities and others, we want to be mindful of looking for options to solve problems. So not just coming in with a preconceived notion, but working with communities, because ultimately we're here to solve problems for the Kansas taxpayers. On to the next slide, please, which says strong progress at the top. We are making good progress. First, I want to say at the very top, thank you to each and every legislator who voted for the Ike program. And some of you I remember from that Wednesday night through lots of conversations between the House and the Senate to get to what I think is an outstanding program that gives us the flexibility and the accountability for delivering really great things for Kansans. So thank you all for your partnership and your support. We have prioritized preservation investment in the Ike program, so that's the first call for our dollars. And as you think about other things that we're doing for the state of Kansas, some of you are on that legislative task force that met all around the state, and you'll recall you said, go try to see if you can find some additional revenue sources. Managed lanes is one of those projects that we're delivering in Johnson County, so the new lane that's being added, that will be a tolled lane. The 2 lanes on the inside are still free, in air quotes, because you're still paying through those through taxes, but the 2 new lanes will be paid for through tolls. We are also doing other things I'll talk about in just a minute in terms of more regular construction, but I'd like to point out a couple of things that we're doing inside the agency to also strengthen the way we deliver. So this is some late-breaking news. I didn't have time to get the slides prepared, but I want to tell you that in 2016, we had 228 accidents, employee accidents. In 2021, 5 years later, that number's dropped by more than 100 to 122 incidents. It's important. Employees are safer now when they're working. Just also to point out, there's a cost savings associated with this. In that same year of 2016, we paid about $1.5 million in workman's comp. Last year, we paid about $200,000. So 2 things, people are safer and we're saving money because of our really intentional efforts for safety. We've also reduced the average days to fill a position from 156 days down to 76 days. However, I'll be the first to say we got a long way to go. We have a hard time recruiting and we have a hard time keeping people. There are workforce shortages all across the country, and we're not immune from that. We estimate about a 30% vacancy for those snowplow operators. So, you know, we will do our absolute best this year, but if we have huge storms, it may take us a little longer to get some of the highways plowed. Okay, now a few more specifics about our program. So it says on the next slide, all new programs underway in 2020. So you'll recall there are some new programs associated with Ike, everything from the cost share program to the reinstated local bridge program to the short line rail program. All of those up and running. You can see the numbers there in terms of the dollars that we have been able to deliver to communities. Now the next slide, really important, you'll see a big 200%. That's an eye-popping number. It's one I'm really proud of. In the last 5 years, we've increased construction lettings 200%. So if you feel like you see a lot of orange cones out there, you do. They're everywhere. 200%. We're not doing it by ourselves. We're doing it with our contractors and our engineer friends. We got a lot of help from the private sector. Okay, next slide. Highway development and construction pipelines. So this is the key feature of the new IKE program because we now have 2 pipelines. You'll recall last year with 4 hours to spare, you all passed the IKE program. Like, you know, I was really glad when that got across the finish line. About 8 weeks later, we put $1.6 billion into the development pipeline. I'm glad to say this summer, the governor and I went around the state and we announced moving about $750 million, $750 million into construction. We've now had meetings all across the state, again, virtually this time, for local consult. And later this year, before January 1, we will be announcing between $600 and $750 million worth of projects to go into development again. We're seeing more of a continuous loop. Work on projects, then as dollars allow, move them to construction, and then go backfill that development pipeline. Okay, next slide. This one says commitment to close the bank of KDOT continues. So all the good planning and all the good plans in the world don't do you any good if you don't have money. We now have money. Thank you. Thank you. You can see there, as the transfers are being closed out, it is that commitment to close the bank that both fuels our ability to let projects and also gives our contractors the certainty they need to staff up, purchase materials, other sorts of things. Next slide, which says approved extraordinary transfers. So there was a question from the committee related to the extraordinary transfers. So at the top, you see the $66 million. That's what, when we think about closing the bank of KDOT, that's the number you typically think of. Okay, so we got $66 million more to close out. However, I want to point out there's still about $30 million in additional extraordinary transfers. That $9.7 million, which is a mental health grant, that's been on our books for years. And it's just been on our books for years. The $320,000 for emergency communication fund, I mean, I think, you know, that's a legit enough expense. It also isn't exactly ours, but that's not a huge amount. We also continue to have the State House debt service at $20 million. I don't know the length of those bonds. I know that payment's been going on for a while. I don't know how much longer it lasts. But anyway, I am happy to point out where we have extraordinary transfers. We also have $110 million in what we consider to be ordinaries. So those are things for like the Highway Patrol, some Department of Revenue because they actually collect gas tax. We budget for the 110. I mean, those are transfers, but they're part of our budget. So those are not extraordinary or something that we don't anticipate. So those are not, we consider those to be a cost of doing business. Okay, on to the next slide, virtual local consult. I think this number is strong and important. So you may recall as we put IKE together, we heard from about 2,000 Kansans as we put the IKE bill together. Now we see about 2,500 continue to be engaged in local consult. I think that's an important recognition that the momentum for transportation, the support for transportation remains strong. Okay, next slide. This is my personal favorite. It's the one with the little girl in the middle. So her name is MJ, and she's in Hodgman County. And I kind of consider her to be like our local consult groupie. She's been coming to local consult since she was 3 years old. And her grandma brings her. Her grandma does economic development for Hodgman County. But here's the reason I think that slide is so important for a couple of reasons. So she was at the construction announcement when we were out in Dodge. But that's why we do this work, right? These investments that we make in transportation should last a long time. Bridges have a lifespan of 50 to 70 years. So when we're making investments, we're making them for ourselves, but we're also making them for our kids. And I think the quote there, when I try to think about how to explain what we're going for in Kansas, and we say like, oh, transportation is important for quality of life, and that always leaves me a little cold, but these words I think are really good, is that there are aspects that have to be available for all members of the family. A good education for students, recreation and sports activities, arts and entertainment, shopping are all vital for a community to do more than survive, but to prosper and to want to stay rooted. And it's that staying rooted part, wanting to live in Kansas and raise your kids here and your kids want to stay. I mean, that's what we're going for. So I love that quote. Okay, on to the next slide. It says innovative efforts. So as we think about MJ and what are we doing to plan for the future, there's some icons here of things that we're working on. That 69 Express is that managed lane project I was talking about in Johnson County. Not only does it raise revenue, but because we can manage the flow of traffic better, it means we're likely not to have to go build the 4th, 5th, and 6th lanes, which saves us construction money, but long-term saves us on the maintenance costs. So wherever we don't have to build more new stuff, we want to take a look at that. Charge Up Kansas, Senator Hawk, for you. I know you ask every single dang time, what are we doing on electric charging? We have about $2.3 million out of the VW, the Volkswagen settlement money that we are now administering. If IIJA passes in DC, Kansas stands to get about $8 million per year for electrification. I want to be clear, we don't intend, KDOT's not going to own additional infrastructure. I think our role is to facilitate the deployment of that infrastructure, but we're not out building charging stations and we're not going to own them and maintain them. We're just here to help get the process going. The RUC study has been launched. You all should have gotten some information about it, but it's the road user charge or the VMT study. So long-term, how do we get off the gas tax? So it's a conversation, it's a study that will continue. We've had good support from chambers of commerce. We just start with focus groups and we move on over time. Happy to come back and talk to you all about that more at another time. Home is a really cool pilot that we're doing in conjunction with the Department of Ag. So when we're out putting fiber in for freight corridors, we're now teeing off if farmers are interested in using one of their fields for different kinds of cover crops. We'll try to get broadband to them so they can do the data analytics necessary to prove that they are sequestering carbon, so it sort of opens up some new markets for them. Voluntary program, but we're working with ag on that. Okay, next slide, where you've got ks.gov.org. Just wanted to promote for just a moment that website. Representative Waymaster, this is your district, but you can see there's like the little gold dot. That's a bridge replacement that should start construction later this month. The preservation work on the gold line, which should start in the spring of 22. Thank God, T-Works is nearly done. And we've got some surfacing work on 281 to do. So anyway, you can go out and see what work is programmed for your area and when, and that's available for everybody. I would also be quick to point out, December 15th, we will be letting the first phase for every T-Works project will be let by that time. Okay, so, and that's one of the requirements under Ike. So December 15th, we will have fulfilled that requirement. Still have more work to do, but we are getting so darn close. Okay, next slide, Home Field Advantage. That was a conference we held in Manhattan virtually with about 12 other states. We partnered with Department of Ag across those states and other state DOTs. And we brought together public and private sector leaders in ag, technology, and transportation to look at how can we drive down the cost of transporting ag products and how can we open up new markets for our states. It was a really interesting conversation. Next slide shows you the top priorities that came from that, which is across our 13 states. So it's sort of the upper heartland states to address key bottlenecks, to really get a stronger focus on rural bridges, because almost every ag load starts in a field on a truck that goes over a bridge to get somewhere. And then to take a look at trying to expand electric vehicle charging infrastructure in a rational way across all 13 states so that you don't worry, oh my God, I'm going to get to the western side of Kansas, and then what's in Colorado next. So those were the priorities that came out of those conversations in terms of transportation. You can see other things that came up on that list as well. And onto our very last slide, Turner Diagonal. So it was awarded the People's Choice Award for the entire United States. So when I say it's a team sport, we had voters from all across the state voting for us. We got $10,000 prize. You always like to get one of those big checks. And our partners, our engineering and construction partners stepped up and have pledged another $20,000. So in conversations with KBOR, we'll be bringing $30,000 of scholarships to KBOR institutions, probably technical colleges, for those folks who are interested in it has to be transportation related, but to the transportation field. And it's such a great project. It's in Wyandotte County. It opened up for the Amazon Fulfillment Center, about 2,000 jobs. We opened it 20 months early. That's almost 2 years earlier than if we'd used traditional methods. Design build doesn't work for everybody, but on this project, it was a game changer. And so I'd like to leave you with a quote from somebody I've never quoted before. But man, for this project and for some other things, I think it works. So Mae West, who predates all of us, but she said, an ounce of performance is worth pounds of promises. So I just am really happy with this project, and thank you for the ongoing funding for Ike, because I think we're doing some good things. Thank you, and happy for any questions.
All right, thank you, Madam Secretary. And it seems like everything is progressing above our expectations when you said we had 4 hours left to pass Ike in that legislative session. I remember being in the conference committee trying to get everything ironed out where we could have something go back to both chambers and get that passed. The one thing that I would like to say is obviously being on the Transportation Task Force, and also those of us in the legislature, was to complete all of the T-Works projects. And I don't know if it was coincidental that you actually had my district, or my home county, on one of the slides. But I do have to say that 281 was actually completed, and it was completed ahead of schedule, because the anticipated date was October 29th, and I believe it opened October 21st or somewhere around there. So obviously the investment that we have dedicated to transportation is paying its dividends. And as you said, December 15th, we should have, did you say all of the T-Works projects
So
led?
one phase of every T-Works project. So in some cases, we have a project, and it's in 2 phases, and so one phase of every T-Works project. So we may have the second phase may not let for a while. And when that is going on, it's usually because we've got a right-of-way issue that has just stymied us, and we're working through those.
And then also, since I used to live in Johnson County and I lived right next to 69 Highway, obviously that project, because if you look at the state of Texas, any new highway project in the state of Texas is a toll lane, or it's a toll road. That's how they pay for it. It basically, the tolls pay for any new construction projects around the highways that are built. And obviously, I think for the Kansas City metro area, 69 Highway is congested. It's also a main artery from southern Johnson County into Kansas City proper when you merge into 35 and everything. So I think it was a good step moving forward with 69 Highway having that one lane being a toll lane. The other question I have, and this may be more of a federal issue, but I know we've had discussions about it with the, let's see, it's the Heartland flyer, and that's the one that it goes from Kansas City into Dallas.
Trying to get there.
Trying to get there. What's the progress? Because I know the issue right now is somewhere around Wichita to Oklahoma City.
Oklahoma, right. So I appreciate the question. And, man, again, a picture's worth 1,000 words. I wish I had it with me. Lindsay, make a note. Let's send it to everybody on the committee. So what we have to be careful of, on the Kansas side, it would be about a $30 million investment to build out the rest of the Heartland flyer. On the Oklahoma side, it's $90 million. And we need both sides to come together. Really, when I speak nationally, what I talk about is we're not trying to connect Oklahoma City and Kansas City, or Oklahoma and Wichita. What we're really trying to do is connect Dallas and Chicago. That's the bigger picture. And we are the piece that's just been left out that needs to be completed. Under IIJA, additional dollars go to both transit and highways and rail. Whether we make the cut or not isn't known, but I think if we talk about it in a broader regional sort of way, we have a better chance at it. What we want to be careful of is that we don't get a little bit of it done, and it becomes sort of a rail to nowhere. So we need all of that to connect, and we just need to be aware that Oklahoma has a heavier portion of the cost than we do. Now, if feds come in and they give us all the money to make those connections, I'd also want to put out a marker for you all to understand that it's probably going to require $1 million, $2 million. I mean, we're doing the service development plan now so that we're positioned and can answer the question. but we probably would be looking at a service fee of $1 to $2 million per year to keep the service up and running at a frequent enough level that it would be useful. So anyway, that's kind of where we are.
All right, thank you. Committee, any questions for Secretary Lorenz? Representative Sutton.
Thank you, Mr. Chair. I was just going to ask for a little bit more context around the Mae West quote.
Twitter.
Thank you, Mr. Chair.
Senator Hawk.
I was waiting for that expansion, but, and I think my question fits its home field advantage. No, I was able to tune in to that, and I can't say enough about what you and your staff's leadership have done, along with the partnership with the legislature in getting this done. And I think one of the things that certainly makes the IKE program and what we're doing in KDOT so successful is the participation you have in Kansas. And then I tuned in to the home field advantage, and really our success is regional too. And I think you had over 300 people from 10 different states that were involved in that. And maybe being selfish with my Kansas ag roots, the focus was on what we can do for agriculture, which actually does affect everybody, whether they're in a metropolitan area or a rural area. So I just wanted to give you and your staff a shout out and the people you had on the program, because I couldn't believe all the people that you had participate in that.
Thank you.
I think Oprah is tuning in to see how you do these things.
I know. Talk show host just may be in my future. Yeah. It was a ton of fun, actually. It was, and if not virtual, I mean, we had Ed Mortimer from the U.S. Chamber. We had the guy from the U.S. Soybean Council. Because it was virtual, we could have panelists kind of come in for 5 or 10 minutes. You know, they always got to speak for 5 or 10 minutes. But it was worth their time because they didn't actually have to travel here. And we had some in studio as well, but it was eye-opening, both on the ag side and we talked about water issues and transportation. It was really this connection, though, with technology is the piece that's going to bring us all together. So it was really interesting. Thank you.
Thank you for what you did with that. Thank you, Mr.
All right, I'm not seeing any other questions. Thank you for being here,
All right,
Madam
thank you.
Secretary.
I look forward to seeing you all in a couple months.
I'm sure you will. All right, the last item that we have before we're going to break for lunch is going to be information that was previously requested by the Legislative Budget Committee, and so I think Amy is going to be giving us an update on that. So, Amy?
Thank you, Mr. Chairman. At the last Legislative Budget Committee meeting, you asked for some follow-up information, but before I get to those, you asked Secretary Burns-Wallace this morning for those guidelines of frontline workers, the $50 million. She has provided those, so we're going to hand those out right now for your reference. At the last meeting, you asked about whether or not the $3 million appropriated for the 988 hotline was sufficient. KDAD's provided information that would not cover the entire projections for the needed upgrades for staffing and technology for those call centers. The projected cost is $5.9 million, according to the estimates from April of 2021. I would note that KDAD's indicated those do not include any additional costs for the state suicide prevention infrastructure, promotion of the 988 hotline to the public, or crisis response programs. In addition, you had asked about whether or not the 988 system could be set up through the County 911 Commission. So you should have a handout in your packet with those individuals and their affiliations on the Kansas 988 Coalition. There is a list. It has a blue banner at the top. Just for your information, at this time, our understanding is that there are currently no Kansas 911 centers that are National Suicide Prevention Lifeline call centers, and therefore 988 calls would not be routed to them at this time. You ask about appropriating federal funds for this purpose. The KDHE-leds did provide some options that had been offered by the SAMHSA contractor Vibrant. We'll get you that list. It'll be easier than me reading those, so we'll provide that to you. You had asked whether or not, for the Department of Education, whether or not the federal ESSER funds could be used for a dyslexia reading program. The Department of Education indicated that those federal funds could be used for a dyslexia reading program if it is being used to address learning loss due to the pandemic, but could not be used for a state-mandated program, as that does conflict with the federal universal grant guidance. Regarding Department of Education for the mental health pilot, you ask whether or not there would be any school districts the state would have to pay for once the federal funds are used. Department of Education indicated the school district choosing to use their federal funds to establish a mental health initiative program would not require the state to provide any funding for that school district program. For deferred maintenance, you ask which buildings built with 51% or more of private funds, which universities have separate funds for each of those buildings. There was a spreadsheet provided during LBC last year, and it appears that only Kansas State University shows separate accounts under the foundation. And then the University of Kansas Medical Center does show a health education building with a separate endowment account for maintenance. All other state universities state the funding comes from within existing university resources, general fund tuition, or other accounts with student fees. You also ask whether or not, or how long the new Board of Regents policy to collect 2% of the current replacement value, how long it would take to reduce that backlog of projects to zero. The Board of Regents indicated that expending only the educational building fund annually, along with the 2% maintenance assessment, it would take 30 years to resolve that backlog. However, they did note that with sufficient annual maintenance and additional participation from the state, it would be feasible to resolve the backlog in 15 to 20 years. Last one, for those housing assistance programs, you would ask for what the national average for rent was, and the average 2022 fair market rent for a 2-bedroom unit in Kansas, as defined by the Federal Department of Housing and Urban Development, is $779 per month. And you also ask what percentage of applicants were unemployed, and that's 18% of applications report no income, and so we're presumably unemployed. I think I hit all the questions from the last meeting, so if you have additional questions, please let me know.
All right, thank you, Amy. Committee, do you have any questions or any comments for Amy in regards to the report of items that we wanted to come back later on? Okay, I'm not seeing any. I know we did have some other questions that you may have by the end of the day in regards to the State House bond that we just had the discussion with Secretary Lorenz on how long that is going to be, or how many years are left on that, and what the balance is of that current bond.
Mr. Chairman, I believe the scheduled payoff for those is in 2034, and we will get you some additional information since those were recently refinanced, so we will get you some additional information.
All right, thank you. All right, I'm not seeing any questions for Amy, so thank you, Amy. We are going to go ahead, and I'm actually surprised that we are ahead of schedule. Thank you, Edward, again, because he was real brief on, he had 45 minutes he was going to talk, and ended up being like 15. So we'll be coming back at 1:15, so we are in recess for lunch. All right, committee, that's on. We'll go ahead and resume the discussion. Hope everybody had a good lunch. The first item that we have is the review of the governor's executive order on the Office of the Child Advocate. And so I would ask that Clay Britton, Chief Counsel for the Office of the Governor, address the committee. Welcome to committee, Clay.
Thank you, Mr. Chair. Happy to give a little bit of an overview of the executive order establishing the division of the child advocate, and then answer any questions. Maybe I'll just start with that overview if it's okay with you.
Fine.
Okay. So I think there's been a healthy understanding of the need for an office or division of the child advocate in the legislature over the last several sessions. So I won't go deep into sort of the thinking about the need behind it. But it's clear that over the last decade or so, our child welfare system has had its share of struggles, and maybe more than its share. Progress has been made over the last couple of years in terms of, in particular, the foster care system, where the caseload has decreased, the number of moves have decreased, additional supports for especially like older youth in foster care have been provided, but there's still a lot of work to be done. And as both the House and the Senate have worked on legislative proposals to establish an independent office of a child advocate, it became clear that there was an opportunity for executive action in this realm as well, and that in light of the inability to achieve some consensus legislatively, the opportunity to do something on the executive level just made a lot of sense, especially when we could follow the lead of the legislature and some of the proposals that have been put forth. So, Executive Order 21-28 establishes the division of the child advocate and places it within a newly created office inside of the Department of Administration called the Office of Public Advocates, which was created by an immediately preceding executive order. As I said, the child advocate provisions in the new executive order borrow heavily from House Bill, I think, 2345 and then Senate Bill 301, which were each sort of different takes on what a child advocate could look like. Here are the hallmarks that have been incorporated into the executive order. First, and maybe most importantly, the independent aspect of the division of child advocate. The executive order sets out that there will be no interference from either the Department of Administration, the Department of Children and Families, or anywhere else in the executive branch. Sets a term for the child advocate, him or herself, of 5 years. So there is no sort of serving at the pleasure of anyone. It is a 5-year term. It prohibits decreases in compensation for the child advocate during that 5-year term, although it does not prohibit increases in that compensation. It prohibits retaliation against anyone in the executive branch for communicating with the child advocate or the division of child advocate. And then it also directs other agencies to cooperate and assist as needed and as requested by the child advocate. The executive order sets out sort of two main pieces of support for the office or the division of child advocate. The first is that it directs DCF to engage in agreements for financial support. Those agreements are to respect the independent nature of the office or the division of child advocate. And respect the provisions of the executive order that say there is no oversight from any other agency over the child advocate. And then it also directs the Department of Administration to provide technical and other administrative support in setting up the office, making sure there's space and the other things that you need to actually run an office like this. The child advocate, him or herself, will lead the division of child advocate and will, according to the order, have to have a professional degree of some kind in social work, law, or some related field such as public health, and then also has to have significant experience with the child welfare system itself. Access to records is something that both of the proposals in the House and Senate and the executive order address, although in somewhat different ways. The executive order does address that the child advocate should have access to agency records relating to child welfare under 38-2212. There's a list of entities or individuals who should have access to these confidential agency records. One of those is sort of a catch-all provision for any state entity or officer who has a lawful responsibility in the context of child welfare. So the executive order sets out that the child advocates should have access to those records via that catch-all provision. Same thing for law enforcement records relating to child welfare under 38-2213, which has the same sort of catch-all provision. Also says that although the child advocate will have access to these sorts of records, there will be no disclosure of any confidential information that the child advocate is able to obtain lawfully. The key thing about those access provisions is that the executive order doesn't seek to change anything about current law, merely to sort of direct agencies to the provision of law that should apply. And then finally, sort of a broad view of the duties of the child advocate, again, modeled on the legislative proposals that we're working their way through at various times. Responding to and investigating complaints regarding specific children or families, keeping records of those complaints, reviewing them to identify systemic problems that maybe need attention either from DCF or from the legislature or elsewhere, recommending those kinds of improvements or broader policy improvements, and then publicizing the work that the child advocate does through a website and through other public communications so that people know what services it provides and how they can get help. And then finally, an annual report is required that would go to the governor, the legislature, the chief justice, and some other key players in the child welfare system. So that's the overview of what the order does, what it's intended to do. I'm happy to answer any questions that the committee might have.
All right, thank you, Mr. Britton, for that analysis of the Office of Child Advocate. Representative Sutton.
Thank you, Mr. Chair. I'm not going to get into the nuts and bolts of the day-to-day practice here, but we are talking about basically a new department or a new office anyway. So we have to look at the funding. This is obviously going to be an increase in personnel, and this comes out of the DCF budget. Is that correct?
That's my understanding, at least initially.
Right, and was going to be my follow-up question. Once we get staffing involved with this, is there any prediction right now of what size staff we're going to be talking about or how many FTEs we're going to be adding in order to maintain this office?
So I don't think there's a specific prediction that has been made with the executive order in mind. As I understand it, I think there was a range of sort of 3 to 9 FTEs that was associated with some of the legislative proposals. I don't think this would be substantively or significantly too different from that, but I don't think we have an actual estimate yet along those lines.
Okay, and so that kind of leads to my next question is, do we have any budget predictions as to what's going to be in the ask when this gets set up?
That is a great question, of course. I probably am not the right person to answer that question because I'm the lawyer and I'm not involved with those discussions. I know that obviously the budget process is ongoing right now, so I'm not sure what the answer to that is, and I'd have to sort of point you in another direction to get that.
All right, thank you.
Yeah.
Thank you, Mr. Chair.
So the funding of this is coming from DCF. Would they also be housed, like physically housed in DCF?
I don't think that is necessarily set in stone in any respect, but I know because we've said that the Office of Public Advocates, in which the Division of Child Advocates should be, is supposed to be attached to the Department of Administration. I think the intent would be that it would be housed with the Department of Administration, but understanding that we have pockets of departments in different places, I'm not sure where the actual office space.
Well, I was just kind of inquiring about that because if we're talking about additional personnel, I'm hoping we weren't going to get into a new lease agreement and get a new office suite or something like that. We could do that within the agreements that we currently already have.
I couldn't say for sure, but in the discussions that I've been a part of, I have not heard anything talking about a new lease or extra office space outside of sort of the footprint that we already are already using.
Right. Committee, any further questions? Senator Billinger.
Thank you, Mr. Chairman. Thanks for being here today, and I know this has been talked about for a long time, and it seems to me like it probably ought to be through legislation rather than an executive order, but can you tell me how many missing children we have today?
I cannot. Luckily, we have a lot of smarter people than I about that at DCF and elsewhere. That's the kind of question, too, that the child advocate would certainly be able to answer once that person is in this role. I unfortunately don't know that number.
Do you suppose there's anybody that could give me that number?
I would imagine in DCF. I'm just not that person.
Maybe you could get it and give it to us. I would appreciate that.
Be happy to follow up with you.
Yeah, and I'd like to know how many are sleeping on office floors at this time.
Also don't know that, but happy to follow up with DCF.
Yeah, if you'd follow up on them too. And how are we doing with foster parents? Is there enough of those to go around?
I don't know the specific numbers. I think we're always looking for more foster parents, but I can follow up on that one too. Again, I'm the governor's chief counsel, so I'm the lawyer. I'm not the policy or program person, so I apologize for not having that information in my head.
No problem. I just figured while you was here I'd ask because we haven't seen anyone else that we could ask the question to, so thank you.
Thank you.
Any other further questions? All right. Not seeing any. Thank you for being here, Clay.
Okay. Thank you, Mr. Chair. Thank you, committee.
We'll go ahead, and I see Alan is here, so we'll go ahead and move on to our next item, which is an update on technology needs for the State House. So we have Alan Weiss, Legislative Chief Information Technology Officer for Kansas. Welcome to committee.
Thank you, Mr. Chairman and members of the committee. Mr. Chairman, if it's okay with you, I have a report in presentation format. I'd like to share that on the conference, if that's okay.
Yes.
Mr. Chairman, could you hit the share button up there for me?
This is a reason why we're having this as a topic, because I can't seem to figure out what.
All right, so the topic is technology for the Kansas State House. And what I'd like to do is do a review of things we've done over the past almost a couple of years now, and then get into some of the things we're going to be doing for the 2022 session. So the first subject is the Kansas Virtual State House project. And of course, that was to outfit the State House with video conferencing equipment, but there was many things we had to do to get prepared for that last session. So we started this project last fall, and it was to implement room video conference systems throughout the State House in the 13 committee rooms, 2 chambers, 10 conference rooms, and the visitor center. and also to implement the Cisco WebEx conferencing system on all the legislator laptops and staff computers. So additional things that we had to complete to make sure that the system runs well is we did an update on the State House data network. We were involved with that, but most of that work was done by OITS over in the executive branch. That was to get our routers up to 10 gigabits in between the switches and continue the 1 gigabits to the desktop. We also implemented new audio systems in all the 13 committee rooms and in the House and Senate chambers. And we updated our streaming service to provide video and audio streaming from the committee rooms. Another very important piece of this was to implement closed captioning on the video streaming. Continuing on the State House, virtual State House, we also implemented virtual voting in the House chambers during the 2021 session. This was to allow the House chambers to expand their seating and provide distancing. So some of the members were in the upper visitor area. We also implemented new voting boards in the House chamber at the end of session, so those will be used in the 2022 session. Those are for full video displays, high-res video displays. We also updated our State House data center firewall devices to provide 10 gigabits of speed and enhanced security. We updated the data center's HyperFlex virtual server system with additional memory. That HyperFlex system is our provides all of our virtual servers for the legislature. We also updated and reconfigured the Exchange email system for better efficiency. We updated the rubric backup system for increased capacity, and then we conducted training on the use of the video conference systems. So the timeline we had with the virtual State House was very aggressive last fall. We met with this budget committee in July, and the budget committee requested we enhance systems in the State House to allow more virtual work. We came back in August 3rd, with a preliminary estimation of $5 million to do the updates. In September 10th, this committee drafted up a recommendation letter to the LCC to approve that project. And then in September 16th, the LCC approved the project. September 25th, we did an RFP for submission of proposals with a deadline of October 12th. Then on October 26th, we went through and reviewed demonstrations from 3 vendors. Then on November 19th, the LCC approved the vendor contract, which was with Worldwide Technologies using the Cisco room systems and the WebEx conferencing. And that same day, the LCC chair signed the contract. Installation of the committee rooms began on November 24th, which was 7 weeks before session start. And then the committee rooms in the chambers were ready by January 6th, which was a very aggressive schedule. And thankfully, everything fell into place to have us have those rooms ready. Yeah, that was kind of amazing how quickly all that came together. Next slide, slide 5, is the funding for the virtual State House. The funding was through the CARES Act and the Kansas Coronavirus Relief Fund. We submitted the funding request on September 3rd last fall. The Spark Committee approved that funding recommendation to the Finance Council on the 16th of September, and then the 17th of September, the State Finance Council approved the funding, and total expenditures have equaled $4.73 million. So this morning, I thought I should add some additional information. This is a side slide that you have, should have been handed out to you this morning. As I said, I apologize. I just thought about this morning, but I thought it was some good information for the committee to have. This is some stats on the meetings that we had during the legislative session. So this was a time period between January 11th to May 8th, and this was only on session days. It does not include the weekends and the holidays. In this time frame, there were 64 session days. We had a total of 2,274 meetings with over 128,000 total meeting minutes, and 22,541 participants in those meetings, which some averages on that, that's 35.5 average meetings per day, 33.5 meetings hours per day, and then 56 average minutes per meeting. So I think that shows we use the systems quite a bit during the session. So on the virtual State House, again, things we have planned for the 2022 session. We have a control room down on ground floor that's 39 East. We plan on outfitting that room with additional control panels that are in the committee rooms for each committee room and chamber in that area. Also have workstations set up for each committee room and chamber, and then have monitors that would display those committee rooms and chambers. So not only will we have staff this coming session, not only will we have staff in the room, but we'll be able to also help control those rooms from a central location down on ground floor. We're also going to implement a test committee room system. This will allow us to test equipment and configurations before we actually implement those in the live rooms. And we can also use that equipment as hot swap spares for the committee rooms if we have an issue during session. I didn't mention here, but also we can use that system for training and to help in that respect. We're also looking at implementing a portable room video conference system with audio for remote room meetings. And what prompted this was the work done with the redistricting meetings. So we are looking to see how much that's going to cost and if we need that system available for us. So other projects that we've worked on or are working on. Last fall, we updated all the legislator computers with a new lease. So all the members should have new computers now. We also implemented new printers throughout the State House. That was done during the legislative session. And currently we are working on the new staff computers for all the legislative staff. Dell has been selected as a vendor for this project. We're currently in contract negotiations with them. We do have supply chain issues that will cause the computers to be delivered after the first of the year. So we will not start implementing computers until April to minimize disruption to the legislative session. And during the October 26th LCC meeting, the LCC approved contracting with Dell and gave the chair authority to sign that contract when it's ready. Another project we'll be doing another security audit this fiscal year to check out our systems and staff to make sure that everything operates securely and staff operates the equipment securely. Some information about the Kansas Legislative Information Systems and Services, also known as the K-LIS system. So K-LIS the system that allows us processing and publishing of bills, resolutions, statutes, and associated documents. That system was initially implemented in 2011, and the system was created to modernize our legislative systems. That system currently consists of data stores, application servers, workstation clients, and about 50 custom applications. The main goal of the system was to allow the public to view the legislative process from anywhere. Other design goals were to implement integrated systems and applications, use open standards, non-proprietary document formats, and use platforms that were secure and easy to update, and implement the State House Secure Data Center and a backup and recovery site for all of our systems and data. Since that system has been implemented, we've continually updated and upgraded it, and we've made several enhancements to the system and applications since the implementation to meet the needs of the legislature. And I have some slides here in the following pages to illustrate some of that. So I call these transparency implementations. They were helped to allow more enhanced views into our legislative processes. 2016, we created a web page so that we could have a list of all the committee hearings that were happening on a daily basis. We also added the committee hearings into the bill history, so if you go to the bill page, you'll see those committee hearings links in there. And then in 2017, we added, on the bill pages, we added links for committee minutes and testimony, so you don't have to go hunting for that. You can just find it right there on the bill page. 2018, we added the requested by, requested for information on the website, and we also implemented a new application for reviser staff to enter that information. That was mainly done for the House chamber. 2019, we created a new page to display the conference committee meeting schedules, and we created a new application again for the reviser staff to be able to input that information to have the conference committee meetings displayed. Next slide. In 2019, again, we also enhanced the bill pages to show a conference committee report reversion table so that it's easier to find the conference committee reports and the different changes. We also, that year, we implemented a new RSS feed enhancement to allow people to subscribe to conference committee meetings. In 2020, we added a new application for, again, for reviser staff to update bill short titles quickly as required. This application updates the short titles throughout the K-LIS system and then allows those titles to be displayed on the website. That gives us a little more quicker updates to those short titles. In 2021, the committee system on the website was updated to allow early release of testimony and allow posting of committee documents. And in 2022, the coming session, we're working on an update to the chamber systems to allow leadership staff access to an application that will allow them to set general orders, which will then go into the calendaring system for the chambers. So my next slide, I think it's slide 11 for you, is the information systems request for proposal. In 2020, the LCC instructed staff to draft an RFP to replace the legislative systems for processing and publishing bills, resolutions, statutes, and associated documents. During the LCC meeting on Wednesday, September 15th of this year, the LCC passed a motion to release that RFP on or before October 15th. And we've released that RFP. It is out for bid now. That was released on October 11th. We posted that to our website and the Department of Administration's website. We also transmitted it to 6 vendors with experience in the legislative systems. We've got the RFP open for 6 weeks for bid submission. And proposal due date for bids is November 22nd. And the implementation date within the RFP is a three-year implementation timeframe, which would be October 2024. And at this time, we have not received any bid submissions. We have received questions on the bids, which will be updating the bid information with those questions for all vendors. So that's the end of my presentation, and I can stand for questions.
All right, thank you, Alan. And I will say, from the time that the RFP was approved last year and then having the short time frame, like you said, 7 weeks, in order to get this building to where we could conduct legislative business, I just want to say thank you for the hard work that you guys did, because it was the only way we could conduct business last year. And it was upgrades that I think we've talked about for the building, but when we had the CARES Act money and we needed to have some type of an efficient way of handling legislative business, it prompted us to go ahead and do that. So with that being said, what were some of the biggest challenges during the legislative session last year with either the new system or legislators on the committee? What were some of the biggest challenges that you had to work through?
Just keeping up on the schedules of the meetings. You know, that's a challenge. Our staff did great. Robin Crumpton is good at making sure and working with the committee chairs to make sure everything gets scheduled. You know, we didn't have a lot of time at the start of session. The systems were turned on the week before session. We didn't have a lot of time to develop processes around working with the committees and how the committees would operate with the equipment. Also, there wasn't a lot of time for training. We did get through some training, but that was during the first few weeks of session. So that was a large challenge. I would say that I think we were very fortunate in that a lot of our staff and legislators are used to working, you know, outside of the building when we got to this point last year. Most everybody had laptops. Most everybody knew how to work the VPN system, so that when it come time to actually do remote work, I think infrastructure-wise with computers, we were fairly well set up for that. Also, when they did the renovation, you know, in the rooms we had conduits in the walls, places to mount these monitors. We had the equipment racks in the closet with the audio equipment. We had to upgrade the audio equipment, but we had space in there to add the video conferencing equipment. So a lot of that stuff was in place to get these systems installed. If that wasn't the case, we would have had a lot more work to do to get this system ready. And you talked about people making this happen. I went through and actually wrote down all the names and counted everybody who was involved in this project that I knew of, and there was over 90 people between our staff, vendors, committee members, executive branch staff, to make all this happen. And there was a lot of risk in the project, you know, that we could have had supply chain issues with getting the equipment here. You know, the installation team that was here, they worked long hours and weekends to get all this stuff installed on the walls and operational. You know, that somebody could have come down with COVID and brought all that stuff to a halt quickly. So we're running up to session worked fairly well. But, you know, during session, like I said, I think from my perspective, everybody took to the technology fairly well. You know, even members, I think all of you adopted to use of the technology fairly quickly. I know there are challenges, and we've had glitches here and there, but we try to work through those, making sure that the network's working and so forth. So, oh, okay. Thank you, Diamond.
Now, and one of the other questions I have to have, mainly in this room, we've had some issues with the microphone right over there that Senator Hawk is sitting at, where it had some feedback. How old are these microphones in the committee rooms?
I mean, it's going to vary because we replace them as they fail. These microphones are still available, so they are a current technology. I can't really say how old some of them are. There may be some that's been operating for several years, but like I said, as they fail, we'll replace them, and we keep a certain amount on hand for hot swaps. So when we did the upgrades in the State House, we upgraded the audio systems in the closet. You know, we didn't install new microphones or speakers in the room because, like as I said, as those things fail, they're easy for us to swap out, and we still can't get those.
And is that kind of the same issue with the microphones at the well in the House chamber?
It is. We handle those the same way, yes.
All right. Senator Billinger.
Thank you, Mr. Chairman, and thank you for being here today. Just a couple of points, maybe questions. In the last several weeks, I've had use of the WebEx for 2 meetings. I was State Finance Counsel, and it seemed like every time I log on, especially if it's a different computer, they want you to submit all your information. Is that a normal deal, or is it just because I don't use it very often?
That was not your state-issued laptop, is that correct?
No, these are at my home. When I'm trying to do it at home, all my equipment's Apple, and I have several computers. And I was on State Finance, and they could not hear me, so I brought my laptop over and I got it going. Well, then you get an echo, but I finally got my laptop worked, but my bigger computer did not work. And then a week before that, I had also one on the state building and construction, and they never could hear me. I finally had to just dial in on my phone so I could vote. So I don't know if I'm just giving you the, some problems that I'm personally having that maybe others are having also, and if we can maybe figure out a way to solve those issues. Thank you.
Yeah, the challenge there is, on each unique device, there are option settings on whether you're on the speakers or what microphone is being used. So there are settings there, but, and I will check with staff and have them contact you to see if they can help you with your issues. But I would encourage everybody to contact our office, our Information Services office. If you are having issues, we can help you. You can stop by anytime down in 63 West. We'll sit down with you and work through any issues like that you're having.
Thank you, I appreciate that.
Senator Hawk.
Thank you, the guy with the bad mic. I think maybe that's appropriate that I would get the bad mic, don't you think, Mr. Vice Chair? So in your report, you mentioned that you're going to have some devices for conference rooms when we have. Will those be WebEx devices, or will they be like, I've seen one called an OWL that is set up with a speaker box and microphones, and it has a 360-degree rotational camera. Is that what we're going to get?
We're not going to change the technologies in the committee rooms themselves. What we're doing is setting up a control room downstairs where we have a central control and view into all the committee rooms throughout the State House.
I'm talking about some of the conference rooms that are not set up with WebEx per se, or am I off base on that?
Now, we have outfitted 10 conference rooms in the building with the WebEx systems, and most of those are monitors on roll-around carts. Some of those are mounted to walls, but they have the WebEx codec and camera on one unit above the monitor.
So if we have meetings with 5 or 6 people, we'll be able to see who's talking and hear, because if you do those with just a notebook and you have a group of 4, 5, 6 people, it's almost impossible for us old guys with the bad mics and the bad ears to hear.
Correct. You can use those rooms. I would also note that we have some additional units. They're called Desk Pros. They're Cisco devices. It's a monitor about that big, but it's got built-in camera, and it works very similar to the room and the committee room and the conference room systems. We have some of those available. So if you have in your offices or conference rooms where you have gatherings of, several people, we could set up a unit in there for you to be able to do conferencing off of those. So just contact our office and with a request, and we can get that set up.
Right, and I wanted to make a comment, Mr. Chair. Thank you. Assuming my mic's still working. No, I want to compliment the staff, and I knew there were a lot of people. 90 is a lot of people to coordinate, and while no system is perfect, I was actually amazed at how well it worked. I had my bias about using Zoom, and, of course, us old dogs, when we learn one technology, we don't easily want to change, and so I had my doubts as to whether anything would work as well as Zoom. And one of the things that I was really happy about is I drive in every day, and I had a few meetings that I needed to go to in Manhattan, and so it would have meant that normally I would have missed my 8:30 committee, but I was able, and I had great luck with my iPhone. Maybe I don't have a MacBook, but it was kind of incredible that I could hook my iPhone up in my car and listen in on the meeting, not look at the screen. So I didn't get any tickets from the Highway Patrol, but I really appreciated being able to participate in the meeting so I wouldn't miss that. And I noticed several of my colleagues probably used the same to participate in committee meetings that they might have missed for one conflict or another. So my other observation is I think we have a lot more citizens that are able to participate, and I especially like the fact that you all figured out how to put this on YouTube. So occasionally during those sleepless nights I have, I will go back and watch some of the committee meetings I've missed, and sure enough, in only 4 or 5 minutes, I'm sound asleep. So thank you, Alan, for the work you and your staff did to pull this off, and I'm sure we'll have other glitches, but I'm confident we'll be able to fix them. So thank you.
I appreciate that feedback.
Representative Johnson.
Thank you, Mr. Chair, and I join the thanks of my colleagues. You likely went through the details on the request for proposal for the system for publishing bills, resolutions, et cetera. But I was trying to remember, when did we get the current system? How many years ago was that? I'm thinking it was within the last 10 years that we went through kind of a major change.
Yeah, 2011 was when we implemented that system.
And were there any learnings that we would have from implementing that one in both selecting and implementing a system that we would be able to carry forward?
I think so. Several members of staff are still here that went through the last update, so I think there were lessons learned, and of course we're going to apply that as we move forward through this.
Thank you. And will the revisor's office or other folks also be involved in that process to get it set up?
They will be deeply involved in the process.
Thank you.
Just on a note on that, we have the negotiating committee for the RFP. That consists of the Director of Administrative Services, Revisor of Statutes, Director of KLRD, Chief Clerk of the House, Secretary of the Senate, and myself. So.
Representative Wolfmore.
Thank you, Mr. Chair. I just want to add my thanks also. You were given a monumental task and you performed so very well. And, I think about it, we went through the height of the pandemic and we conducted a successful legislative session. So thank you for that. And I also have to say thank you to House leadership because they listened to the medical advice. They spread us out. They allowed us to work from our offices if we chose to. So thank you to all. Thank you, Mr. Chairman.
Senator Hawk and then Representative Sutton.
Just one quick question on slide 11, your proposal. Maybe you said this, but why are we not implementing until 2024 instead of 2023 if you get your proposal in 2021?
The K-LIS system, all the applications, I mean, that's spread out across all the divisions in the legislature. It's a complete system for a complete branch of government. So, you know, if you think of bill drafting in the revisor's office, bill processing in the chambers, all the publications that KLRD does, making sure that that's all works well together, getting it published out to a website and out to paper. You know, our current website is an automated dynamic application that actually publishes that stuff in real time as it's ran through the system. So 3 years is I think a tight time frame to update all those systems, but that's what we've defined at this point.
I assume we're going to run it duplicate till we know it works in 2024?
That's one of the things we'll be discussing. I mean, the idea is to implement it by 2024 for the 2025 session. So, you know, whether we do things in parallel at that time, that's some of the things we'll have to figure out.
Thank you. Thank you, Mr. Chairman.
Representative Sutton.
Thank you, Mr. Chair. Well, the senator stole my real question, but I do want to jump on the bandwagon as far as saying I had serious doubts as to whether or not this was going to work when we got back here, and I was pleasantly surprised. I still hate having people testify in front of us on a camera, but that's not your doing. The cameras worked, and so that was a heck of a feat that you guys pulled off in a pretty short period of time, and so I commend you for it. Now, one thing though, this is a rumor, and I just want to see if this is true or not. The new Jumbotron on the House floor, I understand that's going to allow for walk-up music.
The video displays in the House chamber can display any video that leadership decides to hook up to it.
That is wonderful.
And that's all I will say.
Thank you for that. Thank you, Mr. Chair.
All right, any other questions for Alan? The only thing that I would say is, and I was kind of joking with Representative Wolfmore, but actually I'm kind of serious about this, is maybe having some training for some legislators when they're positioning their cameras on their laptops, because I think we saw a lot of nostrils last year. That's just one area, so. But no, thank you again, Alan, for everything you did.
Yes, thank you.
All right, Martin, are you ready? So we're going to move on to the Board of Indigent Defense Service caseloads with Martin DeBoer from Fiscal Analyst from Kansas Legislative Research Department. Martin?
Yes, thank you, Chairman. I'll be looking at the TAN memo that's in front of you. The first page is just a general overview of what the assigned counsel is. It's a meeting of KLRD along with the Division of Budget as well as the Board of Indigent Defense Services. Simply put, assigned counsel are private attorneys that the state uses when they cannot accept cases or there's a conflict with accepting those cases at the public defender level. The bottom of the first page gives a little bit of background on when the fees have changed. If you turn to page 2, at the top of the page, the 2021 legislation that was passed. So in House Bill 2007, the legislature appropriated the $17.5 million, all from the state general fund. And that did include $1.5 million in reappropriations Senate Bill 159 then added $3.6 million from the SGF, as well as a proviso language that for FY 2022, the hourly rate is increased up to $100 an hour from an $80 an hour statutory limit. That is broken down in the table there below. I did want to note that there is a bill that's on the Senate floor. House Bill 2363 did pass the House, passed Senate Ways and Means, is currently sitting on the Senate floor, and that would allow an increase for the assigned counsel hourly rate up to $120 an hour beginning in FY 23. That would have also, if it would have passed, that would have taken place of the proviso, but since it did not pass, the proviso was put in place to increase the rate temporarily up to $100 an hour. So below that, you'll have the caseload estimates in the table down below. The consensus group revised the estimate down from the FY22 approved total. The approved total was $21.1 million, was revised down to $16.5 million. So that is a decrease of $4.6 million. So that amount would lapse in FY 2022. That is a 21.8% change. Looking down at the hourly rate, due to the proviso, they are allowed to pay up to $100 an hour, but those are for new cases that are assigned in this fiscal year. So there's a carryover. So the $80 an hour rate does carry over from FY 21 to 22. So we have an average hourly rate there. We're anticipating roughly around $92.50. For FY23, we are holding flat at the $16.5 million, and that is due to the statutory change. The proviso ends in FY23, so current law would bring the hourly rate back down to $80 an hour. On the last page, in the middle of the page, I did provide a 10-year history of the amount of cases that the agency provided to us, as well as the expenditures for those years. And I'll stand for any questions.
Committee, any questions for Martin? I'm not seeing any.
All right, thank you.
All right, we're moving right along today. Right now, we will have a status for the Docking State Office Building and KDHE lab recommendations. So Merle Riedel, Fiscal Analyst for Kansas Legislative Research Department, you're on.
All right. Good afternoon, Mr. Chairman, members of the committee. My name is Merle Riedel. I am a fiscal analyst with Kansas Legislative Research, and I also serve as staff for the Joint Committee on State Building Construction. So today, just to begin with, I would refer you to the document we'll be looking at is this blue document. It's titled Report of the Joint Committee of State Building Construction to the State Finance Council. A little bit of background on why this report was produced. If you'll remember, the SB 159, Senate Bill 159, which was the Omnibus Appropriations Bill from 2021, tasked the Joint Building Committee to review proposals for a KDHE laboratory and make recommendations to the State Finance Council for that project. And I'll just go straight to page 2. You'll see the first recommendation, or the recommendation of the committee. Committee recommended construction of the Kansas Department of Health and Environment Laboratory at the Kansas Neurological Institute site and renovation or construction of a 3-story event center at the Docking State Office Building site. So a little bit about how we got there. So if you'll remember a little background on this, the provisions of Senate Bill 159 directed KDHE to issue an RFP for a laboratory site within an 8-mile radius of the Capitol complex. And the Joint Committee was to review those proposals. Additionally, Senate Bill 159 also authorized issuance of bonds for both the KDHE lab and docking. However, prior to proceeding with those projects, plans for both projects must be approved by the State Finance Council in a single resolution. And further, the provisions of Senate Bill 159 also required that, or also asked that COVID-19 federal relief funds be considered for both these capital projects. So that's a little bit of the background on it. So now I'll go into a little bit detail on the KDHE laboratory. So if you'll remember, there were some studies produced in January 2020 that concluded that the current laboratory structure which is housed in a 1950s era former military hospital at the Forbes Field, is unrepairable. 3 state-owned sites in Topeka were previously proposed for construction of the new lab at a total cost of about $64 million. If you'll remember, those 3 sites were Lot 4, or the parking lot near the Judicial Center and Docking State Office Building was the first proposal, a site on the grounds of the Kansas Neurological Institute here in Topeka, and a site adjacent to the current KDHE laboratory at Forbes Field. So on September 7th, the Joint Building Committee heard from KDHE, who reviewed 5 proposals that were submitted as part of a recent RFP. These included 3 lease options, 1 land purchase, and 1 option to renovate and lease an existing structure. And you can see in the report on page 3, there is some additional detail about each of those 5 commercial property proposals. So KDHE expressed some general concern about the commercial sites. They would require further assessments related to soil composition and stability for housing a laboratory structure. There was concerns about contract negotiations, and any land purchases would require legislative action. General concern that this would in total delay the construction project. So due to this, the agency did recommend consideration of those 3 previously proposed state-owned properties. The Department of Administration also provided some information. Particularly, they provided an estimate that up to 50% of the total project's costs could be eligible for COVID-19 federal relief funds. So that's mostly background about the state lab. So I'll move on next to the docking building. So on September 7th, the Department of Administration provided updated cost estimates regarding 2 options for renovation of the docking building. Both of those options would preserve the existing energy center, which is built in the basement of docking, and supports many buildings in the Capitol complex area. These estimates were based on a project start date of September 2021. So just to review, and some of these options you have probably heard of before, but option A is the full renovation. So it would renovate the entire docking building and include an event center on the first floor, a food venue, exhibition space, shared conference space, Capitol Police Office, and provide about 268,000 square feet for state agencies. And that's at a total cost of $127.3 million, and construction completion would be in April 2024. And then we have option B, or commonly known as short docking, would remove the upper floors, reuse the lower 3 floors, and add 3 floors for a total of 6 floors. So this would include the event center on the top floor, food venue, exhibition space, Capitol Police, and state agency office spaces at a less amount at 188,000 square feet. Total cost for that would be $112.6 million, with a completion date of April 2023. Again, the Department of Administration provided that an estimate that up to 50% of the project cost could be eligible for COVID-19 federal relief funds. They also noted that the funds from the American Rescue Plan Act would have to be encumbered by December 2024 and be expended by December 2026. So again, in conclusion, the committee's recommendation was to construct that KDHE lab at the KNI site and renovation and construction of a 3-story event center at the docking site. So this report, along with the attached minority report, was transmitted on October 21st to the Office of Governor, pursuant to the governor's role as chair of the State Finance Council. And to date, no date has been determined about when this will be discussed in State Finance Council. So, Mr. Chairman, that concludes my overview. Happy to stand for questions.
All right, thank you, Muriel. I guess my question is, I mean, I don't have a concern or an issue with KDHE lab being built out by KNI, but is there any way you can elaborate on the rationale of just bringing it down to a 3-story event center?
So I can broadly go over some of the items I heard discussed when we were in the Joint Building Committee. So there was some concerns about the full renovation of the docking building and possibly construction of the lab in Lot 4, which would put a lot of people in this space and would require the need for additional parking space. So the proposer of that motion sort of theorized that if the lab was placed at K&I, it would reduce the need for additional parking in the downtown.
Well, okay, like I said, I don't have an issue with K&I, or with KDHE-led being at K&I. What I do have a little, I mean, and the reason why I say this is because this became a moment of consternation last session when we were in conference in regards to the docking building. At that time, the proposal was that we're going to renovate the entire building. And it's an office building, so we need to renovate it. The other reason why I kind of wonder why it's just going to be an event center with no office space is because, I mean, Representative Wolfmore, Representative Sutton were both on the committee in general government budget when we went through some contracts, when they were leasing up other buildings across the city of Topeka because they were moving out of docking. And some of the square footage rates were ridiculous that we were paying. And I thought at that point when we were in conference that the rationale was when we would slowly exit out of these contracts, we would renovate this building, it'd be a state office building, and then we would save money on rent. And now the report or the recommendation that's coming to us is just a 3-story event center. I'm just perplexed, I guess, is the best way I can put it. And I don't know the desire, the need, or the want of just having an event center. And what was the cost of the event center? Do we have?
So there was not a specific cost estimate presented during the committee when that recommendation was proposed. There was estimates for a 6-floor structure that had been discussed. There was estimates for the full building that had been discussed, but in that particular hearing, no specific estimate for the 3-floor structure.
I guess my next question is, in Senate Bill 159, we stipulated that you use federal dollars if we could for this building. Are we going to be able to use federal dollars for an event center?
So I can only speak to the Department of Administration's response to many of these questions is the availability of federal relief funds is somewhat dependent on the purpose that is identified for the structure. And they were, I would say its use as an event center or exclusively an event center was only really presented at the last committee meeting. So I don't know that the Department of Administration had, I don't know that their estimate focused on that as being solely an event center.
Right. I'll generate some more questions, comments, whatever. Representative Sutton.
Thank you, Mr. Chair. We've kind of touched on the first of my questions, and I understand, I can kind of get the stretch on using COVID money for the KDHE lab. I can make that leap. That's not tricky. Event center and office space, I have a tough time making that stretch. I'm curious as to the mechanism involved in order to get that approved. But that really falls second in my list of concerns. What exactly are we talking about with a state-owned event center? That sounds to me like a horrible idea. Competing with conference centers and so forth that are already in town. I'm not, where did this idea come from? Or what were they visualizing when they said event center? I think is probably what I need to ask first.
So I think the use of space as an event center was part of some of the original proposals that emerged in 2020. And that was really based off of a 1 floor. So with the full renovation, it was 1 floor. With the full renovation, it was 1 floor at the base, on the ground floor, 1 floor at the top. That was somewhat driven by agencies identifying that there really was not an adequate amount of event space. And when we say event space, it typically is referring to sort of an auditorium space where one is able to conduct training, perhaps open enrollment for insurance programs. So it's really sort of an auditorium conferencing space. And the Secretary of Administration did identify that this was a need, really didn't exist on a large scale available to state employees elsewhere in the downtown area. So that is why the initial plans had the inclusion of this event space.
Okay. And you listed a couple of items that it might come in handy for. How many days a year do they actually expect that event space would be utilized?
That was not discussed that was not part of the discussions.
Right.
Are you asking how many times did the Department of Administration?
Whoever came up with this idea is really, if it was the Department of Administration, then yes, I'm asking them. Are we going to utilize this space, or is this just going to be more space sitting over there dead when we could have office spaces housing state agencies in a state-owned building?
I couldn't speak to the frequency that space would be used.
Okay. All right, I have some strong concerns. Thank you, and thank you, Mr. Chair.
Senator Hawk.
Thank you. I serve on that state Building and Construction Committee, and I actually also served as a head of a state agency and agreed that we probably needed to have some kind of a larger conference room slash auditorium, small auditorium with breakout rooms. Back when I was in the agency, I had SMART training for the budget, and we got to do that in a closet. And I was right under the paper towels and maybe some other objects similar to that, which I thought was interesting. And so I think we need that kind of space. I also had my office in Docking when we were renovating the Capitol. And I think a lot of times we'll have meetings in this building where none of the rooms are quite large enough for the people who may want to attend. And we could use that space when we're in session. And then I think multiple state agencies would probably use that event space. Now, that being said, I want you to know that I was in the minority in terms of the 3-story solution. I think we need to have some office space, and I think it should be adjacent to the Capitol. And I'm not personally in favor of just 3 stories without having office space. My first preference was for a full renovation of Docking, but perhaps it would have been smart not to fully renovate the whole building initially, keep the cost down, and then have, there's another term for it, Merle, that where you don't fully renovate. It's not white space, it's, what's the term? You know, we used the term mothballing, but we thought that was not appropriate.
It would, there was in discussion, there was a concept to preserve some of the lower floors and use those floors while creating shell space of the upper floors. So in essence, they would remain unoccupied and available for future use, but they would really just have the infrastructure would be stabilized, but nothing would be finished out, or no one would be occupying those floors until that need is identified.
And we, under the Brownback administration, as the chair was saying, we have some very long-term contracts of office space, and the landlords in downtown Topeka are not eager to have the competition of Docking fully restored, but that's today. Is our responsibility to the taxpayer first or the landlords first? And so ultimately, my view was let's compromise on this, and a 6-story building maybe hits the sweet spot, not my ideal solution, but one that gives us additional office space so we're better stewards, gives us the event space that I think we need. And the other critical part to me was that we get a new K&I lab, and I was okay either putting that lab over on the parking lot space or at K&I. And what bothers me about this proposal is we may not get the full use of the ARPA dollars, which could be up to $90 million of this total expenditure of being able to use that. I'm not sure we'll ever have that large an opportunity. So I think it's going to be an interesting discussion in State Finance Council. And if you look on your papers, there's also a minority report that Marcy Francisco wrote and Jared Owsley signed off on, which is advocating the full restoration of the docking building. And there's some interesting points in there, both in terms of energy efficiency, functionality, architectural and historical significance of the building. For me, it's just making sure that in proximity to the Capitol that we have office space, and I still think that's a good decision, but obviously we didn't have 100%, I can't believe it, a legislative committee where we don't have 100% consensus, but I personally felt like the 3 floors, and I think if I read the motion right at the time, that didn't eliminate potentially taking docking down to 0, and that potentially causes a problem with safety on the energy center that actually takes care of the whole Capitol complex. And back in the previous Governor Brownback, there was a proposal to build an energy center off-site, and that was going to be in the neighborhood of $20 million to do that, and another parking lot closer to Eisenhower. And I think that was not judged by the legislature to be a very good decision. So I don't want to do anything to jeopardize what is already a renovated energy center in the basement of docking. Personally, I don't think that's a wise expenditure. And so I don't know that we gave State Finance Council very clear direction, although I did agree with one thing about the motion, and that is any plan is better than no plan, and we've had too many years of no plan. Thank you, Mr. Chairman.
Representative Wolfmore.
Thank you, Mr. Chair. And I have not followed this process very closely, but I guess I'm trying to figure out also where this new plan came from. I know there's been 2 years of study at least on this and input from, I know, downtown Topeka, which I think is appropriate because they are affected by what goes on in docking. So I guess I'm trying to understand the sharp left turn that we've taken to do these 3 stories and no ability for input on that to this point. So maybe you can explain it to me.
Yes, ma'am. I guess really all I can say to that is when the proposals were discussed, sort of the proposals were presented to the committee on the 7th and October 11th is when those recommendations were made. Really the only options that had been talked about for the docking building on the 7th was the sort of short docking with 6 floors or the full renovation. So the final recommendation was brought out on October 11th.
Yeah, and that's my concern because had people known, like downtown Topeka or other interested parties known that this is one of the recommendations for the 3 stories only, they would have had the opportunity to provide information, provide input. So that didn't happen. So thank you very much. Thank you, Mr. Chair.
Any further questions? I mean, I guess, and this isn't a question for you, Merle, it's probably more of a statement that I'm going to make. And that being, I mean, we've been talking about the docking building since, I mean, every year that I've been here, and I'm sure we've been talking about it, you know, I mean, Billinger's been here longer than I, Johnson's been longer than I, Wolfmore, Hawk. I'm sure they've been talking about it then when they were housed there, when we were renovating the Capitol. And then we finally have some direction on where we're going to go with the docking building. And basically, when we were conferencing on Senate Bill 159, it was, we brought up a different proposal for the renovation of docking, and we went with the Senate's position, which was to fully renovate. I mean, that's pretty much what the decision was. And then we get this recommendation. This is not a recommendation on what we need to do with docking. And I mean, the recommendation says, after discussion, the committee recommends construction of a KDH lab at the K&I site and renovation or construction of a 3-story event center at the docking building site. And we have no idea what's going to be in the event center. And so I guess this is more of a statement to the Joint Committee on State Building and Construction, is I really don't think they did their due diligence in looking at what we need to do with that building. Thank you. Okay. Amy, yes, you have a comment on docking?
Not on docking, Mr. Chairman. If it's acceptable, I'd like to introduce 2 new KLRD employees.
Oh, yes, please do that.
So we have 2 new legislative fellows who've been sitting in. They're over here on the side of the room. So we have Julie Michael and Dayton Lemunyon, who are joining us as legislative fellows. So I'd like to welcome them.
Well, welcome.
And Mr. Chairman, we also have some more information on the State House bonding, if it's acceptable to have Stephen Wu will be on WebEx to give us some background.
Good afternoon, committee. Can everyone hear me okay?
Yes, we can hear you.
Excellent. Just a quick update for the State House bonds. As some background, for those online, my name is Stephen Wu. I am a senior fiscal analyst with the Kansas Legislative Research Department. For some background on the State House bonds, as a reminder, renovations to the State House began in about 2000 and wrapped up in about 2013. This project was executed in phases, and bonds financing those phases were issued throughout the decade, throughout the 2000s. In total, there were about 14 bonds that were issued, 14 series of bonds that were issued for a total of about $335 million. The latest payoff date I could find on those was in 2031. Now, in the years that followed, some of those bonds were refinanced and refunded. Most recently, in September of 2020, the Kansas Development Finance Authority, they issued revenue bonds to refund some bonds for the Capital Restoration Project. This had an initial balance of $81.4 million with an estimated payoff date of 2035. And in August of 2021, KDFA again issued revenue bonds that refunded several bonds, including some for the Capital Restoration Project. The total balance for these was about $38.9 million with an estimated payoff date of 2033. So that's just a high-level, quick overview of the bonds related to the Capital Restoration Project. Would be happy to answer any questions either now or could follow up later after this meeting.
All right, thank you, Stephen. Senator Hawk.
Thank you, Stephen. I'm confused of why KDOT is paying roughly $20 million on those capital. When you said there are 14 different bonds, are different agencies paying part of the capital restoration?
No, the 14 I'm looking at are all financed through the entity paying those bills are the Department of Administration.
So why is there wasn't it $20 million in KDOT for capital restoration? Why is that figure there?
I can't speak to why those funds were financed out of KDOT. Would certainly be happy to look into it and follow up with you after, however.
Okay.
Amy might have an answer.
I just wanted to clarify that that's a transfer from the highway fund over to finance those. I'm not recalling which year that occurred in, but it was, we'll get you some more information, but there's a reason they do come out of the, as Stephen's indicating, they are paid from the Department of Administration.
Do we have any other transfers from other agencies for capital restoration? Would be another question I would have, Mr. Chair.
Amy.
Or is it just KDOT?
Mr. Chairman, if it's acceptable, I would ask Dylan to comment on that.
Right, Dylan.
Thank you, Mr. Chairman. Turn on.
Alan, we need a new mic.
Thank you, Mr. Chairman.
I don't believe there's any other agencies that are paying in now. I think there was some lottery funds at one point that was used, but I don't think there's any lottery funds that are being used at this time. My recollection of the KDOT transfer, I think it was 2015, 2016, the legislature, the state was facing a cash crunch, and I believe that's when that decision was made. It was originally a governor's recommendation, so that's kind of how that evolved, and it just sort of stayed on the books.
Representative Sutton?
Thank you, Mr. Chair. And Dylan, didn't it have something to do with the fact that KDOT managed a huge number of bonds already, and this was somehow being baked into that same pie, if I recall correctly?
Mr. Chairman?
Yes.
Since the bonds were actually managed by, these bonds were managed by the Department of Administration, that's not quite like exactly how it came out, although that was a portion of the conversation that did occur at the time. And I'm just, this is a few years back now. But my recollection is that originally, like there was some Department of Transportation funds that were used for the State House renovation because they were responsible for the grounds. And so they were responsible for the, since that was the sort of nexus that was used. And obviously the money being used for the State House renovation exceeds the ground costs at this point.
Fair amount.
Stephen, is there any way that you can forward us some of the information that you shared? We had some committee members who would like to see that information in writing.
Yes, sure, absolutely. I'll follow up with them after this meeting.
All right, thank you, Stephen. Any other questions? Okay, thank you. Amy, is there anything else? I know there's been some questions, and this is not a topic on the agenda, but we probably need to discuss it. There's been some discussion on when our next meeting is going to be. Obviously, probably not going to have a meeting in November. Consensus revenue meets on the 10th. And then I know there's...
Pick a date when Kyle's sick, because this is fun.
Well, I don't know if I can plan it that well, but... and then, of course, then we're going to run into Thanksgiving. And then on the 1st of December, we have ALEC, December 1st to the 3rd, CSG, December 1st to the 4th. So obviously that week's going to be kind of out. The week after that, I know Representative Johnson has a joint pensions and benefits committee meeting on the 8th. The 9th is
340B.
340B. So Representative Wolfmore will be unavailable. So then that week is almost out, except for Monday and Tuesday, the 6th and 7th. And then I actually will be gone December 12th to the 15th. So right now, we were planning on having a meeting December 28th, which I really didn't particularly like planning a meeting on that date because it's between Christmas and New Year's. So one thing that Amy and I have been talking about, we have 3 days left for meetings. So we may just do 2 meetings back to back. Get all the information for the November, the new consensus revenue numbers in November. Other items that we need to address, obviously, we'll have the November revenue numbers come in as well, have that discussion. And then maybe do that if it's, that's why I'm kind of asking if everybody look at their schedules, December 20th and 21st. And then on the latter part of the 21st, probably that afternoon, it'll be recommendations that we'll make to appropriations and Ways and Means, or the LCC if we so do to choose. But we'll probably have a full gamut of items that we're going to discuss on the 20th or on those 2 days. I mean, if we have it earlier in the month, we can do the 6th and 7th. Then we'd probably have to come back. Well, most likely we don't have to, and use that 3rd day. But if we do it in the middle of December or around the 20th, then we can just have those 2 days and then start the legislative session on January 10th. Okay. So if you guys can just get back with me on whether or not those dates work. But right now, I'll just kind of tentatively say the 20th and 21st. And that way we can get everything discussed before Christmas and then obviously before the new legislative session.
Sounds good.
Is there anything else that anybody has before we adjourn? Besides Representative Sutton wanting to stay on because he thought it was fun. Okay, we are adjourned until the next meeting.